Hello, my friends. Jill Osborne from the Interstitial Cystitis Network. It is Sunday, October 8th, and it is time for another live IC support group meeting. Now, my purpose in doing these meetings is to make you so strong, so knowledgeable, so informed that nobody can mess with you. I don't want anybody telling you that you're damaged goods. I don't want anybody telling you that there's no hope. I don't want anybody telling you that you will not get better. Because here's the thing we know about IC. IC can be caused by many different things. IC is a pelvic pain disorder. What does that mean? It means that we're not seeing a disease process happening in the vast majority of IC bladders. What we're seeing is a neuromuscular disorder for the great majority of patients. My name is Jill Osborne. I am the National IC Support Group Leader. I'm the longest serving IC Support Group Leader here in the United States, and I think now in the world. I want to start this meeting by sending our absolute love to Yafit and the Israeli IC organization. I pray and hope that she is safe and that her members are safe. War is so cruel to so many people. And we're going to send all of our blessings to our fellow IC sisters and brothers in Israel. Yafit, I'm thinking about you, hon. If you're seeing this, I'm really thinking about you and sending you lots of love. Now, normally when I do these meetings, I do a little 30-minute intro and then we'll take your questions. I'm always happy to take questions. If anybody's having any sound issues, please let me know. Hello, Donna. Hello, Elise. We are simulcasting live. If I'm looking over here, I'm looking at YouTube. If I'm looking here, I'm looking at Facebook. And I have to start the meeting with Holy Mother of God. You are not going to believe it. These are my reading glasses because I'm older. What do we have here? What do we have here? An article that just came out. The role of viral infection in the pathogenesis of IC BPS. Now, when you think of infection in the urinary tract, it's very easy to think bacteria, bacteria, bacteria. But here's the harsh reality. We're still learning a lot about the biome. We're learning a lot about the urinary biome. We're learning a lot about what's supposed to be in there that's good and what's supposed to be in there that's bad. And there's a lot that is still in the process of being discovered. But we certainly knew several years ago that some IC patients have fungal infections in their bladder, specifically Candida. Candida, drug-resistant Candida, is raging across the world right now. And so our own U.S. National Institutes of Health research team with the MAP Research Network, when they were doing next-generation DNA urine testing, found that some patients who had pain on bladder fill or were struggling with really, really, really severe bladder wall pain had fungus, especially if you were just taking antibiotics. If you notice that you flare when you eat sugar, you flare when you eat carbs, we need to look at that. I have shared that I had a 2-year drug-resistant Candida glabrata infection that I got from taking long-term antibiotics. And I'm going to tell you right now, fungal infections hurt way more than typical IC bladder wall issues. I was a textbook for a fungal infection at my local Kaiser Permanente, which is my health insurance. And I saw almost every doctor on staff. I had some doctors yelling at me saying, there's no way you have fungus. There are other doctors who just kind of shook their head and said we had no treatment. And in the end, it was a drug-resistant Candida glabrata infection, which we were able to kill when I massively reduced sugar. It always flared when I ate ice cream. It always flared when I ate anything milk-based. So cut those out, stopped feeding it, did a couple of long-term diflucan courses of treatment, finally got rid of it. Okay? So we know that there's a fungal possibility. But this then brings up virus, because we had 6, 7, 8 years ago, longer, some research which found virus in patients with Hunner's lesions, that the great majority of patients with Hunner's lesions appear to have an active virus. And this paper is just stunning. It came out on September 6th. I got to tell you, I mean, they go through everything here. So, for example, and one of the things that you have to understand is that we're still developing techniques to identify these things. Remember, 40 years ago, they were doing culturing, urine culturing. And of course, the problem with culturing is it relies on a food base. And so if you have a bacteria and you give it the food that it eats, the bacteria is going to grow. Well, it turns out that doing cultures miss a lot. That's why we do next generation DNA urine testing. That is how they are getting so much better at identifying our urinary biome. So in 1970, Hamash reported they did their first viral study. Now, they were doing viral cultures with rhesus monkey kidney cells, human diploid fibroblasts that were inoculated with buffered urine, and no virus was found. That was in 1970. 1985, 41 patients. They did the same thing, nothing found. Susan Kie, who was absolutely at the University of Maryland, the top researcher of her time, an entire room would stop and listen to her. She also did expansive testing back in the day, looking for virus, and she only found one patient who had one virus, and it was a cytomegalovirus, a CMV virus. Everything else showed negative virus. But testing got better and better and better. So back in 2009, a researcher named Eisen reported 2 patients with IC who had high urinary levels of the polyoma virus that was detected using these next generation PCR testing. One of these patients had Hunner's lesions and received 5 intravesical installations of cytofovir and an antiviral for 5 weeks. And that patient showed significant improvement in bladder pain and urinary frequency after intravesical antiviral treatment. That's something else you've got to really understand. The problem with taking a medication by mouth is you have to hope that enough of that medication actually arrives in the bladder to be helpful. And so there is an absolute trend now, if patients do have severe infections of any type, to actually put the medication in an installation. Put the antibiotic directly in the bladder, put the antiviral directly in the bladder, put the antifungal potentially directly in the bladder. So anyway, we have our first study, 2009, that used an antiviral for a patient with Hunner's lesions. Then in 2014, another doctor did urine samples of 15 patients and found virus in 11 out of the 15, and all of the control patients were negative. Okay, so that was significantly more. In 2015, Winter investigated 50 patients with IC and age-matched controls for the polyoma virus. Polyoma BK, polyoma JC were detected in urine and bladder samples by PCR testing. And viral urinary shedding was more prevalent in patients with IC than controls. All right. And additionally, using high throughput sequencing technology, polyoma viruses were identified in 95% of urine samples from patients with IC. Now, remember, we have subtypes. Not everybody's the same. I'm not saying everybody has a viral infection. But do some patients have a viral infection? Probably. Several studies have detected polyoma viruses in patients with IC. However, they found it in the urine. They didn't find it in the tissue, which is interesting. In 2019, they started exploring the theory that a viral infection is involved in the pathogenesis of bladder wall-driven symptoms. And what they're trying to do is identify normal bacteria versus, normal virus versus potentially pathogenic virus, et cetera, et cetera. In their study, the human CMV infection, Kaposi sarcoma associated herpes, human papillomavirus, Epstein-Barr, were ranked among the first 15 upregulated pathways. And really what that means is that there's a whole inflammatory process that's happening in the bladder. And that inflammatory process is indicated by heightened levels of interleukins and all sorts of different chemicals, right? And so they're trying to use those pathways to try to understand, you know, what infections cause these pathways to be altered and to become inflamed, right? All right, here we go. Epstein-Barr is a devious, devious virus. Um, um, it has now been connected to lymphoma and a number of cancers. So Epstein-Barr is kind of a bad thing. So here we go. In 2018, our pathologist, Dr. Hugh, had an insight into the histopathological characteristics of IC bladders that were similar to the Epstein-Barr infected mucosal tissue. Similarly, a histopathology study investigated Hunner's lesion bladders and found lymphoid aggregates, which are common in viral infections. In the study, now I want you to just hear how advanced the science is. I know you're not going to understand this, but I want you to hear it anyway. Okay. In the study of light chain restricted B cells, were detected in 9 of 46 Hunner's lesion bladder biopsies, hence the possibility of an early, minute, mucosa-associated lymphoid tissue lymphoma in these Hunner's lesion biopsy. Specimens could not be excluded. Previous studies have revealed the presence of Epstein-Barr in 2.2% of specimens with gastric lymphomas, the stomach lymphomas. For their recent okay, anyway, we can go on and on. This finding suggests that Epstein-Barr infection may play a role in these lymphomas. And now they believe, however, our previous study of Epstein-Barr harboring lymphocytes in bladder specimens from IC patients is also being found. So one of the key questions with a virus, which is so interesting, is where do viruses live and how do viruses trigger infection? There's a very interesting study a couple of weeks ago where some researchers were trying to figure out where the HIV virus lives, because if you've got somebody with active HIV, but you give them an antiviral, the virus is not detected. The virus goes somewhere. So they're trying to figure out, where did the virus go? And several patients who were dying of HIV donated their body so that they could basically scour their body to find where the virus was hidden. The virus was in the spleen, and the virus was in some lymph nodes. And this is what we know with HIV, is if we take that patient off of the antiviral, the virus becomes active again. So it's a great scientific investigation to try to figure out where the virus is harboring. So that's concept number one. Once you have a virus, it stays. It's somewhere. And that's something we're going to be learning a lot about with COVID, is figuring out where the COVID virus stays, even when you're asymptomatic. Another question is, what transports the virus? How does the virus move through tissue? Where is the virus living when it's active? And what they have found is that the virus is actually living in a B cell lymphocyte. What is a lymphocyte? It is a white blood cell. It is your body's army. It is what fights infection. So they have now found that this Epstein-Barr virus is hitching a ride on the actual white blood cells. Very, very interesting. So the Epstein-Barr encoded RNA by in situ hybridization positive rate in bladder specimens from patients with IC with Hunners and without Hunners was 50%. So with patients with Hunners, they found the Epstein-Barr coded RNA, and only 8.6% of patients without Hunner's lesions. And in this cohort, Epstein-Barr bladder infection was present in 87.5% of bladder patients with Hunner's lesions. I'm okay, Renee. I'm okay. Let me say that again. Epstein-Barr bladder infection was present in 87.5% of specimens from patients with Hunner's lesions. Now we know why Hunner's lesions can be so difficult to treat. Now we know why Hunner's lesions can recur. Because for some patients with Hunner's lesions, it is actually probably this Epstein-Barr viral infection, turning off and on, off and on. Now, the advantage of knowing this is we can now use correct treatments. And I shared last summer that we had our first study from Europe, and it was actually from Russia, where they were identifying Epstein-Barr and then treating that patient with Epstein-Barr with proper antivirals, and the virus disappeared. The virus went into hiding. So we know that bladder treatments like Elmeron do not work with lesions. The lesions are generally treated with cauterization, steroid injection, hyperbaric oxygen. But if there's a way of suppressing what could be a viral infection, think about what that means to the Hunner's lesion patient. It's stunning. It is absolutely stunning. Furthermore, we investigated Epstein-Barr infection in IC bladders and how Epstein-Barr infection involves the pathogenesis of IC. We examined 13 positive bladder specimens. Among them, 10 were positive for the Epstein-Barr nuclear antigen 1. 6 were positive for a latent membrane protein, blah, 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 blah. You don't need to know that stuff. To summarize, all of their results indicate that the coexistence of an Epstein-Barr viral persistence and reactivation in IC bladders and Epstein-Barr infections delivered by lymphocytes. Our following study with flow cytometry provided solid evidence to show that most Epstein infected cells and B cells were CD19 positive. You don't even know what that is. That's a marker. And B cells should be the main host of the Epstein-Barr virus in Hunner's lesion bladders. The B cells are the primary targets of Epstein-Barr infection in humans. Most patients with Epstein-Barr infection are asymptomatic. In the patients with Hunner's lesion, Epstein-Barr infection, mostly in B cells and a few in T cells, suggests that the virus infection is still active and resulting in persistent bladder inflammation. So I'll have an article on this on our website. I mean, I just literally found this yesterday. And the researchers conclude, since Epstein-Barr infection was present in bladder specimens from patients with IC, using an antiviral treatment may have clinical benefits for the patient. Bam. So all those people out there who are saying everybody has a chronic bacterial infection, you're wrong. You're wrong. Because now we have very clear evidence that patients with Hunner's lesions, probably the vast majority of patients with Hunner's lesions, have an active Epstein-Barr infection. Now, obviously, they want a lot more research to prove this. They have to have the right testing method. They've got to have the, but they lay it out beautifully here. Our recent studies report the presence of Epstein-Barr in IC bladders and Epstein-Barr latency in B cells was associated with BDNF overexpression and nerve hyperplasia in bladders. Virus infection might be a pathogenic factor in some patients with IC, but the mechanism needs to be further understood. I mean, guys, seriously, this is so exciting because, if there's one patient group that suffers the most, it's the Hunner's lesion patients. And if we can have a way of identifying that active viral infection and turning that infection off so that their bladder heals, do you know how many people this will help? This is incredible. Absolutely incredible. All right, so hold on. You guys are seeing a lot of stuff. Sue says, what about COVID? Since having COVID, my bladder has been much worse. Also issues with respiratory system. Have they found it live in the bladder? They have, honey. They have found the live virus throughout the human body. So for example, one of the things that happens, so you guys, you have to remember that COVID attacks the circulatory system. It's delivered through air. So it has that respiratory effect. But where does the virus go once it's infected you? Well, it goes into the blood vessels, and through the blood vessels, it gets circulated throughout the entire body. And we certainly also know that most patients with COVID have microclots from that virus, and some have major clots that have resulted in strokes, having to have limbs removed, especially back in those early days. So what was so interesting in those early days, because remember our, healthcare, it tends to focus on men more than it does women or before women. One of the early issues that resulted from COVID was erectile dysfunction, that men simply could not get aroused after having a fairly severe COVID infection. Why? Well, in investigating that, what did they find? They found blood clots in the penis and they found living live virus in the penis, but they have found virus everywhere. The question is it passive or active? So Sue said, you had strokes and blood clots in my lungs. Exactly. Sue says, how do you know it's not still in your bladder then, even though it's been years? If I could go back to grad school and change my major and go into virology, there's just so much we don't know that we need to study. I loved microbiology. I loved looking for drug-resistant bacteria. That was one of my senior projects when I was in college. But now it's really about understanding exactly what happens with viruses because, most of us were exposed to herpes when we were children just from people kissing us, grandma kissing us as children. So if that herpes virus that gives you the cold sore or gives you canker sores, that's actually a contagious virus. And once you have it, you have it. It's normally silent. Viruses get turned on in patients who are immune compromised, and sometimes viruses get turned on after injury. So if you've ever bitten your lip, you probably get a canker sore there, and that's that virus taking advantage of that injury. And then it has a period of time where it's active, and then it shuts down again. Renee says, you have a tremendous knowledge now. Thank you, honey. Well, I just read everything. I try to read everything. So for my viral infection, and can I just be perfectly brutally honest here? I'm just going to be listen, I'm going to be brutally honest here. My ex was in the military and he went to the Middle East. And when he came home, I flew out to meet him and we made love. Flew home a couple of days later. The roof of my mouth was covered entirely in canker sores. I had like 100 canker sores. The pain was insane. Off I go. Kaiser sends me to the uh, uh, infectious disease department. The infectious disease department is like, "Whoa, Jill, what have you been doing?" And I went, "Nothing really. I mean, I just went back east and I saw my ex, and God bless his soul because he's no longer with us now. And we made love. And the theory was that this was a virus that he picked up in the Middle East. And it was not from oral sex, it was from kissing him. And it really made me pause in my future relationships because I knew now that only happened once. The pain was insane. And then it never happened again. And this was 35 years ago. But I really struggled with how to explain that to a new guy that I might be dating. And I certainly was not going to do oral sex based upon this viral history. Having that discussion with your partner about infections like that, whether it be herpes or whatever, it's just so important. And we just have to protect our partners. So I know that that virus is somewhere living on a nerve somewhere in my head. It is what it is. The blessing here is that I know for me, when I get a canker sore, I can use something called super lysine and wash my mouth out with it, and it cuts the viral infection in half or more. Hold on a sec. Let me go get it. I want you to see it. Hold on. Super lysine. I don't know if it's focused for you or not. Super lysine. So lysine interferes with viral replication. And so I have been telling patients now for the last couple of years for patients who have Hunner's lesions that if it were me, I would be adding lysine to my daily routine. Um, Given this new research that's very clearly establishing a very high rate of Epstein-Barr viral infections in the bladder in patients with Hunner's lesions, right? So, these are drops. You just put a couple of drops in water and swirl, and it's fine. I also have chapstick, and thank God, because I never want to go through that again. And guys. So we know that viral infections get worse during periods of flares, right? I mean, periods of stress. So at the week my parents died, I got a ginormous cold sore, ginormous. And you didn't see me, and it was just horrendous. And I knew exactly why. It was just the massive stress level. Mary says, "How much lysine?" Lysine is a very basic amino acid, and you just do whatever the manufacturer suggests, if not less. I used to chew up lysine pills in my mouth when I had canker sores, but now that I have this, I use this instead. So any sign that I've got any active virus, I go right for the lysine. Sue says, "My husband gets cold sores. I'm so thankful he can tell when they're coming on. My mother also has them. I'm so fortunate that I never got them." Odds are, Sue, you probably have it. It's just probably very latent, because it's super, super contagious. And the vast majority of people have this one type of herpes. But the great news is that you're not affected. So whether you have it or not, Not that important. You're not asymptomatic, and that's what we're gonna go for. Um, hold on. So let me scroll back here and then now you guys please understand the Facebook scrolls and I can't see stuff after it allows me to scroll. So hi Danielle. Danielle says, feel like I'm going through that right now, but I'm allergic to diflucan. There's a great book called The Yeast Connection or The Yeast Connection in Women. That's a book I used. Very careful with those Candida Close products. They're very, very harsh. We usually don't recommend those. Pam says, have I heard of Dr. Lonnie Herman? Yes, I have. Hi Sue. Let's see, Sue. Sue says you sound like you're losing my voice. No, but I'll tell you, I did that 6-hour live stream 2 weeks ago. Oh, that messed up my voice. My voice is still recovering from that. I got a massive case of laryngitis, and I had it all that almost that entire week. So, yikes. Michelle says, I've been on here. I currently have a UTI. I have IC. I ordered D-Manos a few times. Now it's supposed to help fast or take a while. I'm so just tired of this. So Michelle, do you know what kind of UTI you have? Because once you have an active urinary tract infection, you're past the point of using a supplement. It's very important that UTIs are treated properly, that they identify the pathogen, the bacteria, if it's a bacteria, the fungus, if it is, and they treat it with the proper antibacterial, antifungal, antiviral. D-Manos, and why do we do that? Because we don't want that infection to go from your bladder up your ureters into your kidneys where it can be life-threatening. So anytime you have confirmed UTI, you always take the antibiotic. D-Manos, none of the supplements are meant to treat active infections. They're preventative. D-Manos is kind of second string. The very first thing we look for is something called proanthocyanidins, PACs. It's a combination of PACs and D-Manos, which appear to be the most successful at preventing future infection, but they're not going to treat an active infection. And the one we have is it's right here, Prevent, PRVNT, Prevent. So now this is not for IC. This is not for a flare. This is not for diet-induced flare. This is for patients with confirmed E. coli infections. We're going to see recurrent infections most often in a postmenopausal woman who's struggling with recurring UTI from estrogen atrophy. That as you lose that estrogen, your skin gets drier, you lose the protective coating, thus bacteria can now enter the cell much more easily and infect the cell much more easily. If you've had 2 infections in 6 months, 3 infections in a year, you are a chronic UTI, a recurring UTI patient, and you're extra challenging. What the research shows with that, and I attended a lecture taught by Dr. Anthony Schaefer back in Washington, D.C. Many years ago, and he said, as they were trying to figure out why this group of women do get recurring UTI, they were testing their urine every day. They were taking skin swabs every day, vaginal swabs every day. What they ended up finding was that about 24 hours before the bacteria arrived in the bladder, it was living very happily in the vagina. And this then led the researchers to go, well, what's happened to our vaginal defenses? Why has the vagina become a safe haven for infection? And the answer goes right back to estrogen atrophy. And that is why patients with chronic recurring UTI are not only given an antibiotic, they're normally given a topical estrogen to use vaginally to improve their skin health vaginally so that that does not become a safe haven. Hope that makes sense. Renee says the sun brings on these fever blisters. Where is the virus? The virus lives in nerves. Viruses often just live in nerves. But now we know that some viruses are living in B cell lymphocytes, which is freaky. Kayleen says, you got a lot to tell you. Kayleen, I want to hear it all. Let's see. Did that? They didn't give me no, they did. It was a herpes infection just on the entire roof of my mouth. No, we got the name of it, and it wasn't the sexually transmitted herpes. It was the oral herpes. That's far more common. Mary says lysine is helping with the pain. No, not at all. Lysine interferes with viral replication. Renee says that chickenpox virus is one too. Yeah, hello, shingles. That's kind of scary. Again, periods of high stress, your immune system gets suppressed, viral infections turned on, and that's why we have shingles also. Sue says, is it safe to use vaginal estrogen if a person had uterine cancer and now constantly gets UTIs? The research shows that they're now saying that topical estrogen is safe and effective for patients with a history of estrogen-driven cancers. And the fact that she's getting the UTIs kind of proves that doing something that will improve the quality and health of her skin would probably be very, very effective. Sue, if you Google estrogen safety, you're going to find a lot of old information that says it's bad, new information that says a topical safety information. I mean, topical estrogen safety is very, very confirmed. The vast majority of doctors out there now suggest using topical estrogen. Why? Because the estrogen doesn't spread to any great degree throughout into the blood vessels and surrounding tissues. It tends to stay where you put it or very close to where you put it. All right, let's go over here to YouTube. Elise says, I just came home from a beautiful autumn vacation that I really needed. Donna, I'm still in a lot of pain every day, but I'm doing my best to cope with it. Oh, guys, by the way, I got to tell you, like I didn't stream last week because I did not feel very good. And I had yet again lifted something that I should not have lifted, and my back was screaming and my pelvic floor was screaming. And I started, I was just, the muscle, they're so easy to irritate. They're so easy to traumatize, especially as you get older. So I am now sitting on our waffle cushion. Now, as compared to this cushion, right? So this is the cushion. If you have any urethral pain, vaginal pain, rectal pain, perineal pain, you don't want anything touching you there, this is the cushion to get. Each butt cheek is supported, but your crotch area has no pressure. Okay, but my problem is not my crotch area. My problem is in my left freaking butt cheek. And so, and I'm losing weight, which means I'm losing fat, which means I'm sitting on muscle and nerve again. And that's when it gets really bad. There's a good reason we want fat on our butt because that protects all the muscles and nerves. And when we lose fat, then it's like sitting on a bicycle seat. We're just sitting directly on muscles and nerves. And I'm almost where I want to be. Renee says I have the split cushion and it helps. It does. But this cushion really, the waffle cushion really helps me with my left glute pain. Bobby says, "Can we do another coaching session? I have a few issues." Of course, Bobby, not a problem. Just call me. Call me this week. What do I have this week? Something's happening this week. What is it? Something is happening this week. I think, hold on a sec. I think that somebody asked me to, hold on. I think I was asked to do a presentation very quickly. Hold on. This is by my contact at Harvard. Hold on. But she's not there now. Here it is. Yeah. Yeah. So I'm going to be preparing a presentation this week. But anyway, just call. Just call. Because I can't write all the time. I got to get up and walk around. Whenever I'm on the phone, I'm up and walking. So I'm not re-injuring my pudendal neuralgia pelvic floor. Right? Sue says, I've got the same left butt cheek line. It's just, yeah. Mary says, have you heard of anybody having side effects from intrarosa? It gave me scary symptoms, lightheaded, shaking, heart palpitations. It's a steroid or turns into one, I think. I'm not surprised, hon. We can look it up for you if you want. Let me, let's look at the side effects here. All right, let's see here. We're on the website. The most common side effect are vaginal discharge, pap smear, but of course, yet again, they're not putting everything on their website. So hold on. You know, whenever you look at corporate websites, you have to always remember that they're trying to make their product look really good. And so sometimes you have to dig to get the side effects. So here we go. And 4 placebo-controlled 12-week clinical trials, vaginal discharge is the most frequent reported treatment adverse event in intrarosa, which occurs in greater than 2% of patients. As compared to placebo, there were 38 cases in 665 participating postmenopausal women, 5.71%, compared to 17 cases in the placebo group. Abnormal pap smear, 74 cases of vaginal discharge, 11 cases of abnormal pap smear at 52 weeks, on 10 cases of atypical cells. Interesting. So they're not talking about that, but listen, hon, like I always say, nobody can tell you when you need to pee. You're the only one who lives in your body that would know when you need to urinate. And the same is true with how you feel with a medication. If the medication does not feel right, it doesn't feel right. Period. I can remember I took one Atarax, which is hydroxyzine, which is an antihistamine that's very commonly given to patients, especially patients who flare during allergy season. So I flared during allergy season, and so they gave it to me. I took one Atarax, and I knew immediately that I would never be able to take this medication. I don't know what it was in Atarax was known for having a lot of chemical fillers, and it's kind of a junky form, especially generic. Uh, Doing the brand name Vistaril was fine. I had no problems with the Vistaril. I had a lot of problems with the Atarax. So if it didn't work for you, it didn't work for you, and it's okay. You can move on. Kayleen says, can we chat privately later? Absolutely, hun. Okay, hold on. All right, now I missed stuff again. Pam says, Dr. Lonnie Herman makes perfect sense when talking about causes and treatment. Insurance does not cover his treatment, but I don't care. I live every day using Azo and Urogesic Blue, Norco, and sleep meds. I work full time. I've worked over 30 years. So Pam, you have been stunningly productive while facing or struggling with symptoms of IC. And I applaud you for that. But what the other thing I would say to you is if you're still having these symptoms all this time, if there's room for improvement, what the American Urology Association guidelines for IC say is take a step back, revisit the diagnosis, and say, have we missed something? Because now that we're phenotyping, we're really clearly understanding all of those patients who did Elmeron for years or did bladder medications for years, never got better. They still flared. Well, now we know that 80 to 85% of IC patients actually have a muscle and nerve problem as compared to a bladder problem. Thus, doing bladder therapies would never have been helpful for them in the first place. And they did bladder therapies for years, if not decades, kind of what I call chasing the symptoms instead of addressing underlying causation. That's why phenotyping is so important now, so that we can try to identify the best that we can the underlying cause so that we can also identify the most effective treatment for your unique cause. So you clearly have room for improvement if you're still using Azo and Norco and sleep meds. And I would want to know, if I were in your shoes, I would want to know what's going on with your pelvic floor muscles. Kayleen said, had my surgery Thursday only to find out there's no hernia. They think that since I lost the 65 pounds, there's a roll of fat or tissue that can't go away, all because of the umbilical incision from my first laparoscopy. The post-op check call, they sent a referral over to plastic surgery. Okay, I'm hopeful I will be prioritized. I have one Da Vinci incision right now that's underneath my left rib. I'm in so much pain and fatigue. They sent me back to the hospital apartment with only 2 pain pills. Ugh. I have a morning GI appointment tomorrow about how the rectal bleeding caused the UTI. I was really hopeful that the surgery was going to cure everything. But now it sounds like I need 2 more. Girl, it's like peeling an onion, layer after layer after layer after layer. But you should be so proud of yourself that number one, you're doing this. So we're getting slowly but steadily to the root of the problem, right? I mean, that's the goal here. We want to get to the root of the problem. What do they call that? What do they call that? A, a, a lipoma. It's a lipoma. If you ever watch Dr. Pimple Popper, and I love watching medical stuff like that, it's really interesting that for some people, fat just accumulates in one little area. And they can be skinny, they can be heavy, it doesn't matter. For some reason, fat just clusters in one area, and it can create a massive, massive amount of fat, like this big. I just look at some of the Dr. Pimple Popper videos. So you didn't do anything wrong to have lipomas. They just happen. I remember my cat had one. My cat Sammy had one. And I kept feeling this lump kind of by her chest. and I could move it with my hands, but I thought it was weird. And the doctor goes, "Yeah, it's a lipoma, nothing to worry about." And she was a little tiny kitty. Paula says, I read Breaking Through Chronic Pelvic Pain is used suggested for my pudendal nerve pain. I'll be trying another pelvic floor therapist in Traverse City in a couple of weeks. Good. Paula, is that just not a freaking awesome book? Now you can see nerve pathways. Now you can see potential locations, how those nerves get compressed, and most importantly, how they're treated. Fantastic book. Hi, Anne. Hi, Diane. Renee says, I'm doing well with my physical therapy with estrogen cream and estradiol. I was going for instills. I stopped them. I'm having a flare of ulcerative colitis. I'm still having itching and burning and vaginal pain. I also lost a great deal of weight. I have IC with Hunner's lesions. I used to get vaginal fungal infections. You also have HPV. Renee, you did. I think you came in late and you missed my 20-minute discussion about virus. Megan, hold that. I'll be right with you, honey. Hold that, Megan. So, concept number one is the quality and health of your skin. Estrogen matters. As we get older, we lose estrogen. As we lose estrogen, skin gets drier. And so doing the estrogen therapy is good. Doing the pelvic floor therapy, if they find that you have very tight pelvic floor muscles, absolutely the right thing to do. Pelvic floor therapy is very, very successful. The ulcerative colitis is always challenging. Hopefully you're not taking Elmeron, because Elmeron has now been linked to ulcerative colitis. So we want to back off on Elmeron if you're having those bowel symptoms. You can find the blog on that on our website. You're still having itching and burning vaginal pain, and you've lost a great deal of weight. We want a doctor to look at the quality and health of your skin, right? Let's just see how much estrogen atrophy is going on there. That might be a lot. You might need more estrogen. Or you might have bacterial vaginosis. That's something else that happens with menopause, where as we get older, the pH changes down there and becomes a little bit more favorable to pathogenic bacteria. And so you'll probably want a doctor to do a vaginal swab to look to see if you have bacterial vaginosis. And with the Hunner's lesions, we now have very, very strong evidence that over 80% of patients with Hunner's lesions probably have an active Epstein Barr viral infection in their bladder. And there's now more and more research that's focusing on the use of an antiviral. I will be doing an article on this. This is the journal paper that just came out, The Role of Viral Infection in the Pathogenesis of IC-BPS. I'm really excited about that. Kayleen said, would kinesio tape be good to get the pressure off my pubic bone? As long as it doesn't hurt, I don't see why not. Bobby says, what's the best thing for nerve pain for IC this pelvic floor related? Well, number one, we have to figure out where the nerve is being compromised. And we want to address what's causing the compromise. It's usually tight pelvic floor muscles. And so concept number one is find out which nerve is being compromised, how it's being compromised, do the right physical therapy to release that muscle so that it's no longer pressing on that nerve. And then the same sense, doing things that will calm nerves down are very, very important. So some doctors will have you do something like gabapentin or PEA, Peora, which is an over-the-counter supplement, which can calm nerves down as an oral medication, but they might also have you do a lidocaine cream or a lidocaine jelly on the area itself to try to silence those nerves right there in the skin. So it's a two-pronged approach. We want to figure out the muscles, what's going on with the muscles, and we got to calm those nerves down. One of the very first things that I think are worth trying is this. PEA, Peora, PEA 500, a palmitoyl ethanolamide, has been studied extensively in Europe for pain, acute pain, chronic pain, you name it, they've studied it. Surgical pain, fibromyalgia, burning mouth syndrome, et cetera, et cetera. And in 2019, they did an IC study with IC and PEA, palmitoyl ethanolamide, and 87% of IC patients responded very favorably by month 3. So a lot of people ask me, what do I take? Well, I have a healthy bladder wall. I don't have to take anything for my bladder wall. But I'm very invested in keeping my nerves calm and my muscles relaxed. And so this is what I take every night is PEA, just to calm nerves down. If I were having bladder wall issues, pain on bladder fill, which I'm not having, then I would be doing something like bladder builder, which is chondroitin and PEA, or allopath, which is aloe and PEA. The general consensus among the researchers is that PEA as an endocannabinoid calms nerves down. Okay, my pad is crooked. Hold on. Okay, let me come over here to YouTube. Megan says, hi, Megan. Welcome. And Megan, we're simulcasting right now. So if I'm looking over here, I'm looking at you. I'm looking at YouTube. If I'm looking straight ahead, I'm looking at Facebook. Okay. So Megan says, I had painful bladder syndrome, no lesions, pelvic floor physical therapy helped me most. Excellent. I seem to be mostly better now, but whenever I've had surgery or need to be catheterized, I flare. Well, that's because trauma triggers tight pelvic floor muscles. And so when they put a catheter in, that is irritating the urethra. And your urethra might be a little bit narrow anyway because your levator muscles might be a little tight. And the pain of that causes muscles to get tight. That's called the guarding reflex. So that doesn't worry me too much as long as you have a wand that you can use at home to try to nip some of this muscle tension in the bud. It sounds like it's very, very consistent. And, you got this. I mean, the good news is that you've done the therapy. And you know that physical therapy works because physical therapy has worked for you. And so I would just say when you flare, the odds are it's probably a pelvic floor flare. But you do have to remember that we women, as we get older, we start to get a little bit of estrogen atrophy. And that, too, is going to potentially make the bladder wall a little bit more vulnerable. Deb says, hello, everyone. Happy Canadian Thanksgiving. Is today Canadian Thanksgiving? Did I totally miss it? If it is, happy Thanksgiving, my Canada partners. My Canada IC siblings. All right, hold on a second. Renee says, I have lipomas on upper legs and other places. Okay, hold on a sec. Sue says, unfortunately, after being misdiagnosed for 40 years with lesions in the bladder, but my condition is muscle and nerve causing overlapping symptoms. It takes a long time for physical therapy to help, plus throw in some estrogen atrophy and a stroke, which now causes my left side to be weak. It's nice to have a diagnosis, but I still feel like I'm chasing pain. Girl, yeah. Well, you are, hun. Sue, big hug. Girl, you've been through it, but you made it out the other side. You are very strong, day by day, sometimes hour by hour, but you've gotten through some really rough moments in your life. And now at least we understand underlying cause. And now we know what the most effective therapies are for you. It's just you've had a lot of stuff thrown at you this year, and I'm so sorry that life has been hard, but you're one of the strongest women I know, and I do believe you're going to come out this the other side. I do. Kayleen says you can definitely call me after the stream. Yeah, okay, not a problem. I think you messaged me yesterday, and I just was really busy and I couldn't get to it. So I'm pretty sure I have your number. Mary says, I have a serious problem with dry skin, flaking on legs, ankles are the worst, arms as well. Should I ask if I should have more estrogen? I'm on estradiol and take it 2 times a week. Well, Mary, you just want somebody to look at your skin down there. I mean, and just see uh, the health of your skin in your crotch, not on your legs, but in your crotch. You know, aging makes things a lot drier. We have to invest in really good moisturizer I remember when I went to my gynecologist a couple of years ago before COVID, she goes, "Man, your legs are dry down there. Aren't you using any lotion?" It's like, "Yeah, I wasn't really. I do now." CeraVe, that tub of CeraVe lotion is the bomb. So you got to use a lot of lotion, hun, because your skin is changing with time. But I don't think topical estrogen. Remember, topical estrogen stays where you put it for the most part. So putting it in your crotch is not going to make the skin on your legs better. You're going to have to use uh, a skin cream like CeraVe. Pam says, "Here, hold on. Thanks. I know you are right. Was just turned down for disability retirement. I'm sure I have IBS and had 2 lower back surgeries, have lots of nerve pain, depressed. I'm too young for all of this. Taking bladder builder, bladder rest, D-Manos, AEA 500 and hormones. Physical therapy stated I had very tight hip muscles. There you go, girl. That's where you need to spend your money. You got to work on those very tight hip muscles." Diane says, does vaginal Valium help with sleeping through the night? I wake up every hour or two with my bladder hurting and needing to pee. Um, eh, Anything that makes your skin healthier, is going to be helpful for improving the quality and health. Improving the ability of your bladder to defend itself. So that topical estrogen would I would prioritize over the vaginal Valium. What the vaginal Valium is doing is relaxing your pelvic floor muscles. So the question is, what's making you get up at night? Is it your bladder wall or is it your pelvic floor? What we consistently find is that nighttime urination is often a direct reflection of something that's happened during the day. Like if you something like a supplement that you think is fine. I was working with a patient last week who loved her tea. And she was getting up many times a night. And it's like, honey, you can't have tea. You can't have tea. You cannot have black tea. It's acidic and it's caffeinated. So the acid is going to scour the vulnerable bladder wall, and the caffeine is going to trigger the nerves. And then somebody else was drinking a lot of green tea. Green tea is even worse than black tea. So what I would want you to do, Diane, is take a couple of days and do just do a diary of what you're eating and drinking, and see if that correlates in any way with you getting up at night. It could be something as simple as well water. That's overly acidic, or if you're drinking water out of a Brita water filter, that would create alkaline water. I'm not a fan of alkaline water. We want water that's neutral. Or if there's a vitamin that you take every day, or another supplement that you're taking every day, or if you're just haven't been able to give up your coffee or tea or cranberry or whatever. Megan here on YouTube says, fortunately, no surgery is needed, but it's a fear. That makes sense to me. Yes, I have a wand, and I actually ended up teaching restorative yoga at a pelvic floor PT clinic. We'll keep in mind as I age. Good, excellent. I did I always know how my muscles are doing based upon how I urinate. And again, over the week, I could feel my muscles starting to get a little funky, and my urination was a little slow, and the only way I could describe it is like congested. It just felt my muscles down there felt very thick, and urinating was weird. So what did I do? I got my wand and I massaged it out and it went away. And so having that independence and being able to use a wand to nip this pelvic floor tension in the bud early will give you so much power over your condition. Okay, hold on a sec. Elizabeth said, "My bladder got tremendously better after I went on prednisone. I also have a positive A&E titer and suspected lupus. I have Hunner's lesions. Only my rheumatologist does nothing and refuses to give me any meds or even diagnose me despite my blood work, clearly indicating lupus. I want a second opinion, maybe to get checked for some rare, more complex stuff like latent infections. Do you have a recommendations for another rheumatologist?" I don't. I wish I did, honey. I don't. My symptoms started after I was given the human papillomavirus vaccine as a teenager, which contains a whole lot of virus. I could see a link between viral infections and bladder problems. I still ended up getting high risk HPV. I don't remember if the HPV vaccine actually, it's not an mRNA vaccine like the COVID vaccine. Is the, hold on a sec, were they actually giving you dead virus, HPV vaccine? I'm curious. Let's see. The vaccine contains a simulation of the virus, not a live virus. It cannot cause cancer or HPV infection. The HPV vaccine stimulates the body to produce antibodies against HPV. HPV infections are rampant, hon. It could just all be coincidence here. I mean, I my heart breaks for what I mean, when I was a teenager and in my 20s, come on, that was in the 70s and 80s, because hello, I'm that old. We didn't have HPV. We never had to worry about getting a virus that could potentially give you cancer. I mean, there are a ton of different strains of HPV, a few of which are linked to cancer, but most of them are not linked in any way to cancer. What we had to deal with was HIV, AIDS. And the year that I went, I mean, and it hit literally as I was going into college. And, a lot of people think that college is a time where you get to have a little bit of fun, kind of discover yourself a little bit. Well, my first class at UC Santa Barbara was a public health class talking specifically about HIV, how bad it was, and how terrified they were that it would mutate and become airborne, like COVID is airborne. And yeah, that put the fear of God in me. And you know what? I didn't play around. A lot of other people did. I didn't. Sue says, I want to say this. I posted a mugshot of the doctor that was my doctor that did the unnecessary hysterectomies on women as young as 13, because one of his trials is going to be coming up very soon with some charges that are against him. I wanted other people to know, just in case they were a victim of unprofessionalism. And that one person shared it. You would think I posted. Nobody wants to believe a 5-star doctor would do such a thing. I just wanted to make people aware, because it is very important to get second opinions. And this did happen here in Grand Rapids with Dr. Hussam Abed. And yeah, there's a trial beginning. So Sue, unfortunately, ended up in the clutches of a doctor who is now facing major litigation for doing inappropriate hysterectomies or inappropriate surgeries. But no, even more so, there were claims of abuse, if I remember correctly. Now, that's right. It was more the abuse, probably both. Anyway, Sue, you're the expert. I'm not the expert. And it's heartbreaking when we see this happen. And it's so important that we as women stand up and be counted, that if at any time we feel that we're being mistreated, treated inappropriately, that we let people know, right? Because we don't want other people to suffer. And he's now paying the price with some pretty severe litigation. Sue, what were the charges? Diane says, I do the topical estrogen for a year and the doctor said the skin looks good down there. Good. Carolyn says, I drink my well water last year. Didn't know that could be bad. Oh yeah, hon. Well water, listen, well water can be easily contaminated. It's important to get your well water tested regularly, like once a year, because toxins will travel through groundwater and can infiltrate well water. So if there's if there are mines nearby, if there are gas stations nearby, especially the old gas tanks that leaked, they would monitor the gas as it penetrated through the soil all the way around the gas station, eventually to collect in groundwater because the stream was nearby. So the stream was pulling out the gasoline and sending it downstream. So when in doubt, have your water checked. And normally your county water department would do that for you, no charge. Barbara says, what can you tell me about cystitis glandulatus or glandularis? That's the biopsy results, what the biopsy results said after cystoscopy. I have to refresh my memory. Hold on. It's cystitis glandularis. Okay. There are some conditions that occur when normal cells change shape, structure, form. An example of that occurs in the endometrium in the vagina. It's called in the uterus. Sorry, not the vagina, the uterus. It's called endometrial hyperplasia. So consider a woman who has gone through menopause. So they're no longer having their periods, but there's still estrogen in their body. And that estrogen is still triggering a thickening of the uterine wall that you would normally then have a period to slough it off, right? Because the uterine wall, as it prepares to receive a sperm and potentially make a baby, the uterine wall gets thicker and plumper, and then when that baby doesn't arrive, every 28 days, the hormone levels change, and bam, the uterine wall lets go, and you end up having a period. That tissue is expelled. So in older women, sometimes this hyperplasia changes shape, and they call it atypia. So now we have abnormal cells. We don't have normal cells. We have abnormal cells. And abnormal cells are often the cells that are associated with cancer. And so for me, 7 years ago, I had complex endometrial hyperplasia with atypia. And that's the sign that this patient is now at great risk of cancer or already has cancer in their uterus somewhere. So it's kind of similar with the glandularis, cystitis glandularis, in that cells have changed shape and structure. And they are supposed to do, when they find that, they should do a biopsy just to make sure that these normal cells or abnormal cells. Are they precancerous cells? It's common, usually nothing. There's another an outcome. What was the other name that oh, what was it? Oh, um, there's another condition, and the name is just escaping me right now, but it's where the trigone gets very, very, very bumpy. And the trigone is that triangular piece of tissue where we've got uterus, urethra, right? And it's functionally different than other parts of the bladder. And so this cobblestone-like appearance has been described in literature, and some doctors were like, well, this is bad, and they just laser it all off. But now the growing consensus is, no, it's just bumpy, it's okay. You don't have to treat it just because the tissue is bumpy. It's kind of like people who have a smooth tongue versus people who have a bumpy tongue. I have a bumpy tongue. It's weird. Sebastian says, what supplements are good for anti-inflammation? Well, it depends upon what we're trying to treat, what part of the body has inflammation. If you're looking at the bladder or the urinary tract, you're going to be looking at usually chondroitin-based supplements like Cystomen, Bladder Builder, Bladder Rest, Allopath, things like that. I need a drink. See, look, this proves that my bladder is healthy because this is a little bit of lemon Gatorade. I didn't drink lemonade for 30 years. And then I got COVID last May, and the cough was so bad, I was gagging. And I thought immediately, I need hot lemonade with honey. I stopped at the store, bought some. I was shocked that it didn't hurt my bladder. And what did that tell me? What that told me is that my bladder is healed. Any issues I had with my bladder, ischemia from tight pelvic floor muscles, are resolved. I have a good, healthy bladder wall now. I can do lemonade now. I can do tomatoes now. I couldn't do them for years, but now that I've done the proper therapy, I've done the proper pelvic floor therapy, which has restored blood supply to the bladder. My bladder has now healed completely. And I had a hydrodistension. They looked at my bladder and they proved it. My bladder has healed completely with pelvic floor physical therapy. A lot of people ask, well, why does somebody with tight pelvic floor muscles have a food sensitivity? Well, the consequence of tight pelvic floor muscles is a restricted blood supply. If your bladder is supposed to get 24 units of blood a day and it's only getting 10 because your muscles are so tight, they're squeezing the blood vessels, are you going to have a healthy bladder wall? No, of course not. A bladder cannot be healthy if it doesn't have a good normal blood supply. And typically for these patients, they have no idea that they have a muscle injury. And so they embark down the bladder treatment pathway, the Elmeron, bladder installations, etc., but they really never get better, or they still flare. Why? Because bladder treatments don't restore blood supply. If that patient has tight pelvic floor muscles, we have got to do physical therapy on these muscles to get these muscles to relax and release the blood vessels so that that area is now properly infused with blood so that tissues have a chance actually of healing. Diane says, I'm going for a histoscopy because of postmenopausal spotting and an ultrasound showed that my endometrium is 10 ml, so twice what it should be, and that you have polyp, just like me, hun. That's exactly what was going on with me. Hoping it's not cancer. My pap smear was negative with thickening and polyps caused my bladder pain and frequency. No. Would the vaginal estrogen cream cause my problems with my estrogen endometrial tissue? Um, the research doesn't support that. Hi, Nicole. But given that this is happening, they may want you to back off on the estrogen. Just, when I use my estrogen, I use it on the outside. I really don't use it internally very much because I'm not in a sexual relationship right now where I'm really worried about my skin health down there. Not that I wouldn't be willing. Um, so I use most of my estrogen cream right on my labia and at the entrance to my urethra. I don't use it in my vagina. That's going to be a complex question for your doctor. Okay. I have a video on YouTube of what I went through, and I would encourage you to watch it. It's called My Cancer Scare, My Uterine Cancer Scare. I can give you the link to that. Here, hold on. Um, okay. Also, the other thing I was doing this week is I'm uploading a bunch of short videos from IC Awareness Month. I uploaded 15. I got a bunch more to upload. I got a bunch of stuff to upload. So we'll have a lot more videos on our YouTube channel. Diane said, if it's not cancer, my gyne said I should use progesterone, either pills or IUD placed in the uterus. Honey, I did progesterone. So your case is almost identical to mine because that's exactly what happened to me. I was spotting. We waited a long time, 6 months actually. Finally went in, measured my endometrium. My endometrium was 6, I think, or I don't remember what. It was abnormal. And the doctor said, well, you're on oral estrogen. Let's give you some progesterone. So he tried to force a period for 3 months. Period never happened. I was cranky as hell. Came back in, measured my endometrium. It was thick. It was thicker. And that's when he said, it's time for a hysteroscopy. I got to look. He looked in my uterus. He went, oh, we got a polyp here. They did a biopsy. It showed complex endometrial hyperplasia. The next step was a DNC to get in there and to remove that polyp and to do a better biopsy. That biopsy showed complex endometrial hyperplasia with atypia and a vague architectural complex. What that means is it was starting to build a tumor. And the doctors were like, that's it. We got to take it out. They said, we cannot guarantee that you do not have active cancer anywhere else, but you have all the signs of cancer. So, and I was having a hysterectomy 6 days later. It was an it was considered an emergency. Scary. It was scary, but I will happily be your buddy as you go through this. And also, there's a fabulous website called Hister Sisters, histersisters.com. That website was started right around the time the IC network was started. And Kathy, the founder, is a friend of mine. A great place to get support for hysterectomy and the different techniques and the issues that patients can struggle with. That's where I went for my support. But I'm happy to talk to you on the phone, honey. I got through it, and I think you're going to get through it too. But I understand. I felt like I'd been blindfolded and thrown into a back of a car, and I had no idea where I was going. I had no idea who was driving. When you're told that you might have cancer, everything changes. It's so scary. Hister Sisters was stunningly helpful. Stunningly helpful. Sebastian, getting back to you, there are a lot of other supplements that can be used to help fight inflammation. One of the things they say to do is to reduce your sugar intake. I think that that's very, very important. And of course, no artificial sweeteners either. Um, oh gosh, what was I doing? I was looking at uh, buffered vitamin C, not regular vitamin C with ascorbic acid, but maybe a little buffered vitamin C might be useful. Yeah, there's this bunch. There's a bunch. Google it and you can find it. You just have to be careful that it's not strongly acidic. It's a try it and see how your symptoms respond, you know? If you get worse with it, it might not be for you. If you get better, power to you. Diane said, thanks, Jill. So did they take tissue and lymph nodes when they took your uterus and that showed you didn't have cancer anywhere else? So I'm part of Kaiser Permanente, which is that we just had the biggest strike in U.S. history last week. That was crazy. Biggest picket lines I've ever seen. I would have had to drive 90 miles to their uterine cancer department in Sacramento. And hysterectomy is an outpatient procedure. And so I could not in my brain envision driving 90 miles home after having a hysterectomy. And so I begged my doctor here locally to do it. And he confirmed, he worked with the oncologist and said, okay, we'll do it here, but you have to understand that if we find anything suspicious, you're going up to Sacramento for a second surgery where they're going to take up more lymph nodes, et cetera, et cetera. And so they looked at everything they removed. I had a total laparoscopic assisted hysterectomy. And they found complex endometrial hyperplasia with atypia and a vague architectural complex. So what that means is they caught it right at that moment where it was beginning to turn into cancer, but they got it all. And so I did not have to have more lymph nodes taken. They were very confident in that. They sent all my stuff to Stanford University. So go figure. All right, guys, you got to hit me with questions. Give me some good questions. Challenge me. I'll either know it or we'll look it up for you. I wanted to look up one thing. So we did put up a couple of new things on the IC Network website this week. Stacy, our writer, most of the IC Network is written by me and by Stacy. I write the scientific stuff, and she writes the human interest stories most of part. But she's starting to dive into research a little bit more, which is great. And so we have a new blog up right now on the UTI vaccines. MV140, also known as Euromune, is a vaccine self-administered by patients using a spray under their tongue daily for 3 months. Studies have focused on women who have recurring UTIs, with UTIs being one of the most common infections in women. Here, hold on. Euromune has been around for about a decade. It targets 4 bacteria common for UTIs, and it shows positive results in studies. Thus far, 73 studies have examined MV140, and 19 of them specific to recurring UTI. Of those 19, 5 met the criteria to be critically reviewed, totaling 1,400 women. Up to 78% of participants remained UTI-free for 9 to 24 months post-treatment. Nichols' team, Curtis Nichol, the big IC researcher in Canada, did this work. He found that Euromune reduced the incidence of UTIs by 82% for 9 months post-vaccination. Patients went on average of 11.5 UTIs per year to 2.1 UTIs per year. Successful studies are continuing, and no major safety concerns have been reported. So, one of the questions then is, would Euroimmune potentially help IC? Um, the short answer is yes, for certain types of phenotypes of ICers. In April, Curtis Nickel and his team released preliminary findings looking at this exact question. They started with a small group of 16 women who had both IC and recurring UTI. Overall, the patients did well with Euroimmune, since recent research showed that women with recurring UTIs have an imbalance in two types of their bladder mucosa. The researchers postulated it might be helpful for the infection subcategory of IC. Researchers speculate this subcategory has a hypersensitive sensitivity to bacteria present in the bladder. As such, removing or improving toleration of bacteria could improve the symptoms. The results of that small study were incredibly promising, with none of the patients having a UTI following vaccination. At the end of 9 months post-vax, 6 patients remained UTI-free, while all patients had at least a reduction in UTIs compared to the previous year. Even more promising, 81.3% of patients reported a moderate or marked improvement in their IC symptoms after treatment. So the second one is a vaccine pill that's being studied at Duke University. It's administered under the tongue, but it's a dissolvable pill, and it activates immune cells that attack UTI-causing bacteria. They've only gotten through animal studies right there, but they're, I think, moving on to human studies soon, if they haven't already. So that's very, very exciting that we're going to have a UTI vaccine sooner rather than later. The other blog that we released is a blog on coping with seasonal changes, seasonal affective disorder. So, seasonal affective disorder is a type of depression triggered by seasonal changes. Its symptoms last 4 to 5 months per year. If you're already struggling with depression, then seasonal affective disorder can add to it with the colder months symptoms, including oversleeping, overeating, weight gain, and social withdrawal. It's known as SAD. SAD, which occurs more often in women than men, usually impacts those living in northern climates with dramatic weather changes and frequently begins in early adulthood. Treatments for SAD include treatments for depression, such as psychotherapy. Antidepressants include light therapy and vitamin D supplements. If you suspect you may have SAD, talk with your doctor about your symptoms to get medical help. If you aren't sure whether your symptoms qualify as severe and require medical intervention, there are assessments online that you can print your answers to take with you to your doctor. While 5% of adults in the US experience seasonal affective disorder, 10 to 20% of US adults have a milder form of the winter blues. Some self strategies, like the ones that follow, can help mitigate these feelings, but seeking advice from your healthcare provider is always the best place to start. Number one, get your tush outside, my friends. Exposure to any degree of sunlight increases your vitamin D levels and lowers your melatonin. Vitamin D raises your body's serotonin levels, which impacts your mood. The less sunshine in colder months can lead to vitamin D deficiency. Getting outside helps to mitigate this. And I gotta say, like this morning, I did a huge hike this morning. I mean, like, I'm discovering this whole new world that I had lost track of in the last 20 years because I was caring for my parents, right? And I was always the last to bed. Usually got to bed about 2 in the morning because I couldn't go to bed before they went to bed because they were very elderly and they needed my help. So I would go to bed at 2 and wake up at 10 or 11, right? I now sometimes get up at 6 or 7, and it's like the world is alive out there. It's like revelatory for me. There's so many people walking early in the morning. And I feel like I've just opened up this brand new part of my life to just like start the day outside in nature. And it feels so good. And some days I walk twice a day, just to be outside and letting nature heal the sadness that I feel as I grieve for my parents has been very, very helpful. She also talks about eating the right foods. Anyway, there's lots of tips on all of this. One of them, maintaining a schedule. That's something I'm really doing now. I'm usually in bed slash my recliner by about 10. Um, I can't sleep in a regular bed because my jaw starts to dislocate. I have to sleep up. TMJ from very, very tight muscles. Oh, life. It's so freaking complex. Anyway, really good blog over on our website. You're not alone. If you're struggling with depression, if you're struggling with grief, if you're just struggling, it's not your fault. It's not your fault. Life is tough right now. Life has been tough for all of us for several years. Give yourself a break. You didn't do anything wrong. And we got some really good resources over on the IC Network website, especially some really good mind body medicine techniques to really kind of guide you through some very easy grounding techniques to calm some of that depression, to calm some of that chronic anxiety and catastrophizing that stress triggers. It's under our mental health section, our emotional health section over on the IC Network website. In fact, I kind of like feel like we need to we need to do a couple of the techniques. So here, hold on a sec. I'm going to blow you away. Can yeast be hormonal? I don't know. Mary said, "Is the spray nasty tasting?" I have no idea. You're probably not. My son is paraplegic and gets UTIs often. Boy, it's going to be life changing for your son, Mary. And you might even be able to get it here in the United States on a compassionate use, because I think I talked to another patient a couple of weeks ago who was able to get it. Diane says, "Thanks, that makes sense. I'll look at your YouTube video. I'm trying not to get too worried because I had just a little spotting 2 months ago." Yeah, good, Diane. Just my personal policy is that if I'm in pain, if I'm bleeding, or if there's something that's worrisome, I want to talk to my doctor. I want them to look. I'm not interested in anybody guessing. I want facts. I absolutely want facts. And that was a mistake I made. Is we waited 6 months before we did the hysteroscopy because my doctor guessed. And I let stress stop me from doing a hysteroscopy when he first suggested it. And so just do it, get it over with. Let's see what the hell you're dealing with. Angie said, "I've been drinking mint tea and it's helped so much healing my digestive system." The Interstitial Cystitis 101 book you have on the website, it has so much. Good, honey. Thank you. For those of you who don't know what that book is, that's our latest book. And this is the only book that talks about phenotyping, which of course is now the range. That's why we say IC 101, it's not just a bladder disease. Our new national guidelines say that. We beat them. We predicted it. So IC 101 is not just a bladder disease, is a really good starter for anybody who's newly diagnosed, because it will help you understand not only the diversity in patients and why we don't want you to just take bladder treatments for years, because we know that doesn't work. It explains the possible subtypes, but more importantly, it's just filled with self-help tips and lots of reclaiming comfort and fitness, tons on self-help. For example, here, hold on a sec. And I was reading chapters of this last. So we have our bladder wall flare rescue plan, our pelvic floor flare rescue plan. Here, hold on. It's how to improve sleep quality, emotional support, managing anxiety, depression, relationships, family, friends, tips to make life easier. Here, let's go through the tips to make life easier, just for fun. Shall we? Let's just do it. What are our tips to make life a little bit easier when you're struggling with IC and pelvic pain? Number one, wear comfortable clothes. Buy more comfortable and stretchy clothing, especially pants that can give as you move. Many patients live in stretchy yoga clothing. I do. If you must wear slacks, buy a size larger to get more room in the crotch. You can take them in elsewhere. You can use scissors and make little downward slits and elastic waistbands to make more room. If you're a woman, you can find comfortable, attractive clothes made. Oh, we have a couple of companies that we suggest here. Number two, empty your bladder before meals if you experience frequency and pressure. Eating should not be rushed. You do not need to anticipate a trip to the bathroom while trying to enjoy a meal. Number three, carry a portable urinal in the car, even if it's just for peace of mind. That's what I do. Let me show you. Listen, buy a pack of Travel Johns and leave these in your car, in your center console or your glove box. Listen, if you're stuck in your car and there's no bathroom, this is what pilots use of small planes flying long distance. It fits perfectly to your crotch. Just drop the trowel, stick it in there. You can pee right into this. There is a powder at the bottom of it, so it immediately solidifies, so you're not going to leak. It comes with wipes. This takes the worry out of driving. Now, and that was something I was very, very worried about. I was very, very worried about that. But once I started carrying these, you know what? I've never had to use them. I have the same Travel Johns that have been in my car for the last 10 years or 20 years. It's just for peace of mind. And you know what? If you get in a tight spot, you can use it. If not, you're good. It eases worry. When traveling, carry body heating pads, an ice pack in a freezer bag, or a cool water cone, which only needs cold water to chill. Patients in cold climates and those who benefit from heat on their pelvic floor and low back find heated car seats very healthy. Heated car seats are a double-edged sword, though, because if you sit on a hot car seat for a long period of time, you're going to cook up a very nice candida infection in your skin. Yeah. Number four, wear a pad or guard under your clothes if you aren't sure about restroom accessibility. There are several new brands of incontinence underwear that fit very well and look great, including Evershere's Wherever It Speaks, but be very cautious of pads that have strong scents. Try it for an hour or so to determine if you're sensitive to it before wearing it for a long period of time. If you've got to do a long plane flight and you're just not sure if they're going to let you use the restroom, listen, this new absorbent underwear, try it. It might take the worry out for you. There are some great apps online called Bathroom Diaries, Sit or Squat, Have to Pee or Miss Pee to help you find bathroom locations. Carry a medical alert card or ID or bracelet or necklace that says interstitial cystitis or pelvic pain engraved in it. With a letter of verification from your doctor and or a restroom access card from the IC network. To gain access to a restroom or to the front of the line when flying, or even if you're at a concert, something like that. You can get handicap parking permits. Avoid standing in long lines at the post office. Listen, I print all my postage here at home, here in my office. Well, I have a postage meter right there. Anyway, that's just filled with lots and lots of tips. We got good information on diet, on sitting. We've got pelvic floor exercises that you can do to try to help relax your pelvic floor. I do all of these at least once or twice a week. How to work with your doctors. And what makes this book all the more unique is this whole discussion on sensitivity and chemical sensitivities and environmental illness, which is very common for those of us with widespread pain. How to find personal care products that will not be irritating. It's so interesting, for our IC subtype widespread pain central sensitization, of which I'm also in this group, we have the most sensitive nervous systems ever. And I always know when I'm talking to patients, because they say they can't take anything. They always have reactions to it. And it's like, "So, do you have a wicked sense of smell?" "Yeah." "How'd you know that?" "Oh, because I have the same thing. You and I have a very sensitive nervous system." And so for us, it gets a little weird because, you know, um, we can't tolerate certain smells. It's weird that an odor would cause pain, but they do. And so we're the ones who are going to have to run out of the room if somebody sprays oven cleaner or somebody sprays bleach, or we've got to leave the house if somebody's washing a carpet. This strange chemical sensitivity and environmental sensitivity is freaky. And like I've got to get new windows. All these windows, these are all the old windows from 50 years ago. This is why my PG&E bill was $950 last winter. They're all coming out. But one of my worries is they're going to use a glue that I'm going to smell. That's going to bother me. So Megan says, yes, I have many chemical sensitivities and I'm allergic to fragrance. The difference between an allergy and a sensitivity is an allergy causes uh, trouble breathing, your throat swells. Whereas a sensitivity is really just very irritating. It's like your body interprets it as a toxin, but it's not affecting your breathing so much. Sandy says, so happy for you. Love getting to walk. Yeah, I do. I do. It's just finding, it's like finding your center again. Mary says, can I still get the cards listing the good and bad foods for IC? Yeah, they're right on the IC network in our shop. It's a little card that lists the good foods and the bad foods that you can carry with you. It's like 99 cents or $1.99, something like that. It's over in the IC network shop. Our restroom access cards are over in the IC network shop too. They're very cheap. And we're the only ones with the diet card. We also have our diet app for phones, but it hasn't been updated and it's probably not working. I haven't updated it in a few years, not since COVID, and it costs at least $20,000 to update each app. So we have our diet app and we've got our bladder tracker app, and I just don't want to put the money in that. Those are always losers. They never, I mean, thousands of patients use it, but it's not money for us. So, especially Bladder Tracker app, which is free. I mean, that was just $25,000. We were going to charge for it, and then at the last minute, we decided not to. 99 cents for the app, or $1.99 or $4.99 or whatever. So I'm a little gun shy updating apps right now. So Sue says, or wait, Diane says, I wear dresses a lot, so I'm comfortable with my IC and IBS. Yeah. I'm all yoga pant or very, very stretchy jeans. If it doesn't have stretch in it, I don't wear it. And yet they're not grandma pants. I mean, I wear yoga pants. My generation, we're dressing young. We're not cutting our hair and doing curly perms at the age of 50, like my mom's generation. Sue says silicone caulk has a very strong smell. We just replaced our sink, made my throat tight. I believe it. Yeah, I'm a little worried about that. Diane said the toughest situation for me is going boating with my adult kids and grandkids, and I have to pee after an hour and a half at most, and I can't pee in the lake. Not sure if it's fear of getting bacteria in the lake in my bladder, or I can't relax my muscles to pee. I don't want to miss out on family time. I think I'll take azo and ibuprofen the next time just to make my husband take me ashore for a bathroom break about 1 hour. Oh, come on. Yeah. I mean, everybody should have access to the bathroom at least once an hour. Or, if you had get used to jet ski, get off the boat, get on a jet ski, and go use the bathroom. I don't like deep water, so I'm not a lake girl. Deep, deep water scares me, or brown, muddy water scares me. And I can swim really well. I just don't like deep water. Sue says, cold water can make your muscles tight, make you feel like you have to pee when you're in the water. That's true too. The other thing is if you're in certain parts of the Amazon and you pee, I think it's the Amazon, and if you pee in a creek, there's a parasite that follows the pee right up through your urethra and into your body like a worm, but it's only down in the Amazon, I think. And it's like, yeah, that's another good reason not to pee in a lake. Oh, life is so funny. And Sue says, no, 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 the parasite. Yeah, I mean, that's the thing is that especially, and like here in well, in Hawaii, as an example, in Hawaii, everybody thinks going to Hawaii is a great thing, right? Okay. I went to Hawaii and I got a sewage virus in my ears. So here's what happened. This is freaking crazy. Now, this was before I was diagnosed with IC. And it was a little, we were flying over to see some family members who were living in Hawaii. So on the plane, I have a flare and it feels like a bladder infection. And I was very, very uncomfortable. So the next day we went to Kaiser Permanente, who happened to have an office there. And we had this sweet little Japanese doll, apple doll of a doctor, very elderly, very small doctor, very strong accent. And she goes, you no go beach, you no go water, no go water. And she's like, no go water, trust no go water. And I'm like, why? And she goes, trust me, don't do it. Now we're at the beach. I mean, we're in Hawaii. I want to go to the beach. So so I listened to her for that entire week. I did not go past my knees until the very last day. My cousin who was in the army over there, we went snorkeling at Hanama Bay. And we went kind of out far. I mean, I kind of scared myself because I got deep. I didn't like that, so I immediately swam back in. Anyway, the night before we were to fly home, I woke up at like 5 in the morning and I couldn't focus my eyes on my clock. The clock number just kept sliding to the side. It's like, what the hell's? And then when I tried to stand up, the room was spinning. Scared the living daylights out of me. I could not walk. So I crawled down 2 flights of stairs. We were in my uncle's house. I was on the 3rd floor, crawled down, and this is an old World War II home, so this is nothing fancy. Crawl down the stairs. My parents are in the basement, down in the 1 bedroom down there. Crawl down there, crawl into the room. Help! I can't stand up, right? We call the emergency room. And they go, oh, yeah, we see at least a dozen of you every day. You've got the sewage virus in your ear. And I'm like, what? Sewage virus? What? And she goes, now the room will stop spinning in a couple, 8 hours. When the room stops spinning, come in, we'll give you some meds. So eventually we get to the ER and they're like, yeah, we see you all the time. Honeymooners, we see you all the time. And they say, well, what you don't know about Waikiki is the sewage goes out 5 miles in a pipeline off of the beach. And then the tide washes it right back into the beach. So you're literally swimming in very, very diluted sewage. And so I couldn't, and the number one rule when you have this is you cannot fly. I mean, flat out, you may not fly. You're not going to be able to fly for a week. Your inner ear is massively infected and messed up. So I had to call my boss and say, "Okay, I can't come home for another week." And they're like, "Yeah, we don't believe you. You're staying in Hawaii for that." But no, I actually had a virus in my I couldn't ride an escalator or elevator for a year without the room spinning. It was crazy. So, like, I'm really angry about this, right? Well, 3 weeks later, 3 weeks after we get home, I'm watching TV and they had the consumer portion of our local TV station. And they had an expose on the sewage problem and everybody getting this ear thing in Hawaii. And that what they just basically discovered is that even when they find active sewage in the water and they issue a warning, the sign is so small that people can't see it because they don't want to stop tourists from coming to the island. And they showed it all. There you go. So as Sue said, no, 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 the parasites. When I always say when you're going anywhere tropical, or even we've had a couple of cases this summer of people going to water parks in Texas in the South where there's like amoeba in the water that can be fatal. So it's very important that wherever you swim, you know that the water's tested and you look for warnings, especially if you're in Hawaii, okay, or and any tropical island. Donna says, I lost my husband to liver and colon cancer three weeks ago. Oh, honey, I'm so sorry. My bladder's been all messed up and I've had Hunner's lesions and now my bladder is shaped like an hourglass. I've two I've had two bladder augmentations. My husband was on hospice. He stayed at home. I was his caregiver. It was so hard to watch him leave me. I haven't been drinking much water and anything these last couple of weeks. Stress, I'm sure. Oh, honey, it's grief. Listen, you've just done the hardest thing you can do. You gave your husband such a precious gift to be home. Because that's what he wanted, was to be home, safe, comfortable with the people that loved him. But you took on a devastating role. And you did it willingly. You did it with love because you wanted to be there for your husband. Of course, you were going to care for your husband, just like I cared for my parents. But once they're gone, it is a shattering experience. Uh, I mean, you're at 3 weeks, I'm at 4 months. And grief is a powerful force that cannot be denied. It's so incredibly important that you, number one, don't beat yourself up. You have done nothing wrong. You got to take life slow and gentle and easy and be proud of every moment that you cared for your husband. Oh, hon, that was such a fabulous gift that you gave him. But you were the caregiver, and caregiving is difficult. And it's even more difficult when they're gone because now you're grieving, but you're not alone. There are some fabulous grief support groups out there. Um, I will tell you that by week 3, I was still sobbing every day, but I wasn't doing the mega sobbing. I was doing the 2-minute sobbing instead of the 1-hour sobbing. Like time helps. It will give you context, but it's so incredibly important that you be easy, you be gentle. Donna says here, I'm 6 months with the loss of her son, Jason, and the grief is real. I mean, it, I, again, I have no shame. I will share anything. I, but I'm not ashamed of it. I will tell you that last weekend, I sobbed for like an hour. I mean, it was like the day after I lost him. I sobbed. And it was because of something somebody said to me that really, I was very hurt. And, but I'm not, that's grief. It's okay to cry. I think just try to get outside, get in the sun, do things that give you comfort, do things that give you joy. If you just want to sit with a cat in your lap and a heating pad and read a book, by golly, you do that every single day. If you want to get out and take a hike in a park, you do that. That's what I'm doing now. I send you my love, Donna. I send you my love. And I know that both Donnas. I mean, I'm like really shocked. I had no idea grief would be. You always think you're prepared, but you're not. You're not prepared to hold the hand of your loved one after they've gone. It leaves an indelible mark on your soul. I get great comfort because I'm a believer. I have very, very strong faith. Very, very strong faith. And I feel my mom walked with me this morning, I'm sure of it. I have no doubt about it. And I was wearing a pair of her earrings when I was walking, not these, different pair. I was, to invite her along the way. I believe in spirit, and I believe that spirit stays close. And I believe that we will be together again. And so I personally got a lot of comfort from um, listening to Joel Osteen, Don Edward, Tyler. I have very strong faith. Sue says we get toxic algae blooms in our Great Lakes that can kill. Yeah, we have them right now at our lake that I walk around. Grief is there no matter how long it's been. Gay, you're absolutely right. You're absolutely right. That's why I think faith really matters. Um, whatever faith a person chooses, just have that comfort in knowing that it was worth it. I have no. I told somebody today, I have no regret. I have no, even though it was tremendous sacrifices on my end, no regrets. I'm really proud of what I did. Donna said, I'm so afraid to leave the house after winterize everything. Cars, water lines, you're so scared to be alone. Small steps, honey, small steps. So, you know what I want you to do? Well, number one, you need to, um, let's see, how do I want to say this? How do I want to say this? You notice here, every window in my home is open. I do not live in a cave. The sun is always shining in my house. The walls in my office are yellow. I very purposely live in a happy, encouraging home. The sun is always shining in my home. So let the sunlight in, honey. Open the windows, open the drapes while you can. And I want you to open your front door. And I want you to just walk out to the street. Take a couple of deep breaths. Come on back in. And every day, just walk a little bit farther. If you can just walk out your front door and then go 2 houses away, and then just come on back. We're building a new foundation of trust in your body. We're building new strength. We're building a new journey. that begins with a step. So, and I will tell you, I wore sunglasses the first month because I sometimes broke into tears when I was walking. It's okay. And I think if there's anything that this has taught me is that as you're walking and meeting people and doing your life, we have no idea what their stories are, that they too may be grieving. And it's that connection with others that brings even more comfort to be able to, like, for example, when I was walking around the lake last week, there was a lady who was sitting very quietly in a bench trying to look at the lake, but she was kind of also hidden from the lake. And I walked by her and I just thought, something's not right. So I turned around and I walked back and I said, honey, are you okay? Are you okay? And it's moments like this that where you can touch the life of somebody else, because truly sometimes helping yourself, the best way you can help yourself is to get out of your head and help somebody else, right? If you ever, I can remember I was at the doctor a few years ago, and there was a woman who was just sobbing across from the reception desk. And she was sobbing. She wasn't wailing. She was sobbing. I'm looking at her and I'm looking at reception. I'm looking at her and I'm like, she's crying. What are you going to do about it? I'm looking at reception. They're like shaking their head. Well, I went over there and I sat next to her and I said, honey, are you okay? And she said that she'd just been diagnosed with cancer. And I just held her hand and said, oh, I was exactly where you are 6 years ago. I went through exactly the same thing. And she kind of looked up at me and was like, really? And I went, yeah, really, really. We just did some very gentle, deep breathing. And sometimes the best thing you can just do is just sit down next to them. You don't even have to say anything. And I'm winterizing my house. I'm getting a lot of work done now, but I did nothing for the first 2 months. And so, Donna, it's okay. You do what you can do, but ask for help. If you got family members who can help, if you have to pay to get some help, it's okay. Yeah, you're scared to be alone too. Yeah, embrace your embrace your inner bitch. That's what I do. It's like, listen, you made it this far. You're a strong, tough woman. You just provided care for your husband. That proves that you are stronger today than you have ever been in your life, because you are truly one day older, one day wiser. You just earned your doctorate in caregiving with what you just did. And so rather than focusing on how weak you might feel, why don't you focus on how strong you feel right now with some really good affirmations? I can do all things through my faith which strengthens me. Every day in every way, I will get through this. I can do all things. Be bold, and mighty forces shall come to thy aid. Having really good affirmations that you can say to yourself during these moments is important. Just taking in some slow, deep breaths, maybe once or twice a day, sitting outside and just breathe. Just close your eyes, put your face to the sun, or put the wind in your face and just let it hit you. Just let nature, the calm of nature, start to center you. Donna, what are the techniques that Donna over here on YouTube, what have you found to be helpful as you have gone through your journey? Are there any tips that you can share with Donna on Facebook? I would love to hear what you're doing to try to ease your very, very difficult journey. And Gay lost her husband 5 years ago. So, Gay, how about you? Gay, what are some of your tips? I started eating right. When I was under great, great stress of caregiving, I was eating like crap. I was eating a lot of sugar. I was eating a lot of salt. I was eating a lot of cookies. Um, that's all. I've stopped all that now. I'm just like taking charge. I'm cooking again. I made enchiladas the other night. Who knew I could eat enchiladas? But my bladder's healed now. Danielle said it's my son's birthday today. He turned 30. Aw. We love celebrations. Donna, he's still, is he still with you? I'm scrolling back. I want to make sure I don't accidentally. Or Danielle. I'm sorry. That was Danielle. Danielle, I feel like I have paper cuts in my private area. It goes away after I put estrogen and take medicine, but I've been having pain all week, worse than usual. Well, so anytime the vulva is that irritated, we want to look to things that can trigger inflammation. Like number one, laundry detergent. If you're using a scented laundry detergent, that would leave enough chemical in your underwear that would really trigger that skin. Fabric softener, it's a great no-no. You cannot use any fabric softener, any dryer sheets at all when you have sensitive skin down there. We have to avoid anything that leaves a chemical residue in underwear, which can then irritate your skin. That's important. Um, Bath soap. We want to make sure you're not using a soap which is irritating. You're afraid to take a shower. Why would you be afraid to take a shower? I mean, water's fine. A plain bar of Dove soap should be fine. I mean, that's what I use. The Dove unscented is fantastic. You say you don't want to burn yourself. Water will not burn you. Use Dove soap, okay. You can using a Perry bottle. And okay, so here, hold on. Every member of the IC network gets a Perry bottle. And this is let me just open it up. Now that I've opened it up, I can't give it to anybody, unfortunately. Okay. So you fill this up with room temperature water, leave it next to your toilet. Every single time you urinate, rinse yourself off with water before you pat dry with toilet paper. Why do we say that? Because water will get all the chemicals off of your skin. Remember, one of the conditions that happens in women who get the estrogen atrophy is what we call urine burn, where literally as you're urinating, if your urine feels hot, like it's burning your vulva. Well, it's really not burning your vulva. Your urine is not hot. What that means is that your skin is dry and tender. And toilet paper will not get the chemicals off of that skin, but water will. So the single most important thing that you can do when you've got vulvar burning is to rinse yourself off with water every single time you urinate. Mary, did you have the $25 membership or the $50 membership? It comes for people who get the $50 membership or higher. And if you didn't get one, pop me an email and I'll just have them send you one anyway. Okay, it's not a problem. These are in the IC Network store. They're like $4. Super, super cheap. But just I find every time I go to the bathroom, I'm constantly trying to get the toilet paper out of my hooey. So what does that mean then? Um, Danielle, is your skin dry down there, or are you using something like coconut oil on your skin? That skin is supposed to be wet, but it's not water wet. It's actually hydrophobic. It repels water. So your natural mucus on your vulva and in your vagina is actually a very, very light oil. And so um, uh, when we're trying to quench that skin and protect that skin, we're all this is doing is rinsing off the chemicals. It's using that very, very light oil like V Magic or coconut oil before you urinate. Will then give that skin a barrier so that urine is now not going to find those wounds. You take vaginal estrogen every day, even though it's supposed to be 3 times a week because I'm controlling my frequency and urgency with it. Well, you got to have a reality check here. All the estrogen is doing is helping that skin produce mucus. The estrogen is improving the quality and health of your skin. The challenge here is that all the skin is estrogen dependent. So when you're young and have lots of estrogen, you have lots of mucus. When you're older and you have much less estrogen, you have less mucus. That's not a disease. That's what we call estrogen atrophy. And clearly you're in estrogen atrophy, just like I am. And you're still dry. Okay, so you're never going to have 20-year-old skin again. You have older skin, even with the estrogen. So you might want to, again, daily. Use this daily for a couple of months. Just keep that skin healthy. Rinse off the chemical. This is going to be very, very helpful. I learned this from a vulvodynia support group meeting that I went to back when in the 20s, when a bunch of older women took me under their wing to help me with my vulvodynia that you're describing. Okay. But in addition to that, using something like V Magic, this is an oil made of organic olive oil, avocado oil, sea buckthorn oil, honey, and it's very, very close to natural mucus. It's not sticky. It's as close to natural mucus as you're going to get. So a lot of women will use this on their vulva in the morning and they do their estrogen at night. I feel like my vagina got so small and tight it hurts to use my plunger. Well, either your pelvic floor muscles are tight or you're in very, very severe atrophy. And so sometimes what a doctor will do is they'll just have you using it on the outside first. Let's just get the vulva really healthy, right? And so one of the advantages of having a cream is you can put it in different places. So for me, I tend to use mine more on the outside than the inside. You tried to call me yesterday, honey. That's a Saturday. I don't work. Saturdays are basically the only real day that I have off all day. Um, Sundays, I do this. Mondays is my other time where I try to have a little bit of time, but I usually start answering the phone after noon on Monday. Otherwise, my staff answer the phone. For this summer, I'm sending Heather, who helps us do fulfill orders. I'm sending her home at noon this summer. because we're shipping a lot through Amazon now, and so she's not answering the phones. She'll start back full time probably, I don't know, in a month or so. So I've got most of the IC network phones afternoon. So you can call afternoon, and you're going to get me because I'm the only one answering the phone, unless Janice starts answering the phone. But that's probably not going to happen. You can get the V Magic right, woohoo, on the IC Network website in the IC Network shop. Go to icnetwork.org and click on the store link. No, hun, Western time. We're in Pacific time. We're in California. So it's going to be 3 or 4 o'clock your time to be noon or 1 o'clock my time. And I function on a first come, first served basis. Yeah. Now, and Sue says, can people get free shipping through Amazon now if you have an account? You get free shipping. I have to pay for your shipping. That's the thing. Amazon is destroying small businesses right and left because, when you're on Amazon Prime, you're thinking, yeah, I mean, we send product to the Amazon warehouses. They're the ones who ship it to you. But guess what? I pay for your shipping. I do when you use Amazon free shipping. And so Amazon is a lose. It's a loser for small business. So if you can order it through the IC network, right now we have 50% off shipping with the code FB50. And that way I'll pay for half of your shipping if you'll pay for half of your shipping. And that's even for priority mail. And technically for express mail, but don't tell anybody that because that's expensive. Carolyn says, is that better than plain coconut oil? The challenge with coconut oil, Carolyn, is it soaks through. I have had a couple of very embarrassing moments with coconut oil. I have a couple of long cotton sundresses, one in black and one in dark blue. And you know what happens when an oil gets on cotton? It gets darker. And a couple of times I came home and my butt it looked like I'd had an accident. Yeah. So this one, I think it's a little bit better. I just found the coconut oil to really penetrate through fabric and underwear. Even though I was wearing underwear and stuff, everything got oily. Mary says, so V Magic is not needed often. I use a 5% lidocaine cream, relieving cream. Is that okay? It's good as a V Magic. Well, they do different things, hun. The lidocaine, the relieving cream is calming nerves down, but it's not necessarily protecting the skin. This, on the other hand, protects the skin. And so, as Donna said, last week or 2 weeks ago, what she does is she mixes lidocaine with the V Magic and uses that. Gay says, after I lost my husband, I started doing a lot of coloring and playing computer games. Yeah, I play World of Warcraft at night, but not a lot. But I played last night. Danielle said, I'd rather you get the business. Thank you. Sue said, then why are you using Amazon then? No judgment. We don't have a choice. Amazon is so easy for people. So I have a lot of, you guys remember, we did the product launch for almost all of these supplements, Sister Project 20 years ago. We still did the product launch. It's where the market is. It's where the market is. And so sometimes the way we find new patients is they go to Amazon, they look for bladder supplements, they find Bladder Builder. and it comes from us, and they go, "Oh, the IC network? I didn't know there were any IC groups." So it's kind of the cost of doing business, but I'll tell you, we've taken a real hit financially, a real strong hit with financial, and because Amazon keeps raising prices, and then the post office keeps raising prices, and then patients want free shipping, and it's like, why can't you give me free shipping? Well, if I give you free shipping for this, then I can't even pay my staff. You know, there has to be an area where we can make a little bit of money to pay the bills. And also there are a couple of people, just to kind of warn you about this. They will buy stuff from us pretending to be a patient, and they'll sell it on Amazon for 3 times the price. So a supplement that might cost $35, they're going to sell for $90. And they're just waiting for it to go out of inventory. When it's out of inventory from us, theirs pops up and a patient will pay $90. Yeah. Danielle says, my aunt got a holistic cream for yeast called Yeast Arrest, made by Vitanica. Good. Carolyn says, which one of your supplements help the bladder nerves? Peora is an endocannabinoid that acts to calm nerves down directly. But then something like Bladder Builder, you get it not only can it can protect the skin so that the nerves aren't quite so irritated. So really the question is, what are we trying to treat? In my case, I'm pelvic floor driven, central sensitization. My bladder wall's healthy. I'm drinking lemon right now. Okay. And so I I don't need to do anything for my bladder wall other than estrogen. On the other hand, my nerves are very, very sensitive. So my treatment priority is to calm my nerves down and to keep my muscles relaxed. That's very different from somebody who has, you know, I mean, 10 years ago, I couldn't drink lemon because I was still in ischemia from tight muscles. So, yeah, but absolutely, as you're trying to get off of the amitriptyline, swapping over to this, even though it's a different method of action, would be a very interesting experiment, at least. You just have to talk to your doctor about the right way to do that because some medications can cause a tolerance and you have to go off of it slowly, potentially. I don't remember if amitriptyline does that or not. I did amitriptyline for 3 months. It gave me a very rapid heart rate, and it really messed my heart up. So I was off of it within a day. I don't remember having a problem getting off of amitriptyline, but you want to talk to your doctor about it for sure. Danielle says, "Have I heard of yeast arrest by Vitanica?" I have a long time ago. It's been around for a long time. Um, Let me look at it. Yeah, yeah, I think we even might have carried this in the IC Network store at some point in time, or we were talking about it. Um, it's a homeopathic. You try talking for a few hours. Sometimes it's hard to verbalize. Unique homeopathic combination specific for symptoms associated with vaginal yeast infections, such as borax, sepia, berberis, and creosotum. I think we decided that there wasn't enough data to show us that um, homeopathic remedies would be useful. Yeah, I know. Yeah, I know. It was made by an actual doctor, but so were the other supplements for the most part. They were all made by doc. A lot of them were made by doctors. That doesn't really mean anything because remember, doctors have to make a living too, and there are some doctors out there who um, you see them on TV all the time pitching whatever it is they've made because they're trying to make money. So it's really all about data. I always counsel patients when I'm working with them. Hi, Deborah. No worries. That um, before you invest your money in something you've heard secondhand or from something that you've heard from a company trying to sell you something, look at the data. It's like, I got to tell you, when I started with the IT network, I agonized because I had so many people trying to sell stuff in the IC network forum. This was before Facebook or anything like that. The IC network was the home for all things IT. And I had sales reps pretending to be patients every day coming in and saying, try this, try that, try this, try that. And some of them were absolutely outrageous. Drink the juice of a lemon or sleep on magnets. We had a magnet salesman saying you can cure your IC by sleeping on a magnet. And I was talking with Dr. Tony Buffington, who's was our premier IC researcher in cats, in animals. And I was like, doing a woe is me moment. I can't make anybody happy. I keep saying no, no, no. And they're saying I'm violating their free speech. And he goes, Jill, you need to learn about the Oxford scale of evidence based medicine. Use that to determine what you will put on your website. And I'm like, okay. Gave me the link, went and read it. So in the Oxford scale of evidence-based medicine, you base the credibility of the information you receive. So an F is information from another patient or something from a company trying to sell you something. Number one, because the patient isn't a medical professional, and for all we know, they're a completely different phenotype than you are. And number two, companies are always going to make things look good when they're trying to sell things. So that's an F. A D is information from a single doctor or from somebody who's very, very educated and knowledgeable. Like I'm a D. A C is a preliminary research study, a B is a better study, and an A is a double-blind placebo-controlled study. And so for all these people pitching stuff, I said, okay, show me what you got. And as soon as I asked for research, 95% of them went away. They were just F's. Good case in point, a company selling low acid tomato sauce. Hey, we got a great pasta sauce for your patients. I'm like, really? How'd you take the acid out? They put something like bleach in it. I'm like, no. Why would you do that? Why would you do it that way? That makes no sense. And the same is true with some of the early 20 years ago stuff like that. Can you imagine that? Somebody basically putting something very similar to bleach in tomato sauce and selling it to you for low acidity. It's crazy. Sue said a lot of us took Elmeron, which is made by a drug company, and look for that. Yeah, true. What do we do with chronic yeast infections? Well, with chronic yeast infections, Danielle, have you ever made yeast bread? I make yeast bread every holiday. I make Norwegian Christmas bread every holiday. My house is filled with used to be filled with loaves of bread that we gave to family and friends. So how do you proof yeast? You have warm water and sugar, and you pour the yeast on top, stir it up, wait 15 minutes. What does it do? It bubbles. It grows. Well, that's because yeast needs sugar to grow and a warm environment. And so rule number one, if you have chronic yeast infections, is to stop feeding it. You're feeding it with sugar. You're feeding it with carbs. And that's where the book, The Yeast Connection, and the book, The Yeast Connection in Women really helped me. Like, I didn't realize that a cup of pasta was equivalent to like 3 Snickers bars. Like, I don't eat candy. And yet I was eating enough sugar that was equivalent to candy in a cup of pasta. And so I would encourage you to get the book, The Yeast Connection, and ice cream. Danielle, I got to tell you, when I had my Candida glabrata infections, Anytime I ate ice cream, it flared like a beast within 8 hours. I was in agony. And fungal infections can not only be in the vagina, they can be in the bladder, and we have proven that. And the bladder pain from a fungal infection is off the charts. Emergency room, Norco, Vicodin pain. Carolyn said, I've had a yeast infection since April. Doctor just gave me estradiol, which I'm not crazy. Carolyn, the estradiol is critically important. You need the estradiol because without the estradiol, your skin is going to stay dry. Remember, your skin is wet. The vulva, the vagina, the urethra, and the bladder are mucous membrane organs just like the mouth. And that moisture plays a very, very important role. That mucus plays a very important role because it's a barrier. It protects the skin. It keeps bacteria off of the bacteria have to basically eat through the mucus to get to the cell, right? And it keeps the toxins in urine away from the cells. It's a nice, natural, protective layer. But these layers are estrogen atrophied. So when you're young and have lots of estrogen, you have lots of mucus. But honey, if you're postmenopausal, you don't have the estrogen anymore, which means you don't have the mucus anymore. This is called estrogen atrophy or the genitourinary syndrome of menopause. And topical estrogen cream, is considered very safe. Why? Because you're not swallowing it. When you swallow, oral estrogen is a whole nother story. Oral estrogen, when you swallow it, it gets into your stomach, it gets absorbed into your bloodstream, your blood carries it throughout your body. That absolutely is associated with a higher risk of cancer. But topical estrogen does not deliver that way. Topical estrogen stays on the skin. And the vast majority of research in the last 5, 6, 7 years has shown that it is very safe, even for patients who have cancer or have a history of cancer. So, what I would encourage you to do is, you know what? There's a fantastic, let me see if I can find it. Hold on a sec. There is an absolutely fantastic article on this that came from the New York Times last spring. And it goes into the terrible injustice that was happened when one journalist completely misinterpreted estrogen safety results. And this drove this massive scare in the use of estrogen 20 years ago. And before you know it, all these women are off of their estrogen out of fear of cancer. And what's happening now, what happened then, of course, is they started having all these urinary symptoms. So the New York Times actually did this fantastic article, and I will send you they gave me 10 free copies. I probably still have 1 or 2. I can email you a link to it. It goes through every point, data by data by data. It shows exactly where it happened. It shows exactly how the data was misinterpreted, and it shows all the safety data and why topical estrogen is so critically important to the health of women. So when you don't have the estrogen cream and you don't have the mucus, your skin is basically wide open. It's very easy to become infected because you don't have the barrier anymore. What we want to do is we want to get that skin as healthy as we possibly can so that it can repel and protect itself. Dawn said, I was just diagnosed with atrophy and given compounded estrogen. Took estrogen 10 years ago and it put me in a horrible flare. Afraid to start it since I've been in a flare since August 30th. Also diagnosed with a cystocele, and the doctor said he doesn't think surgery would help. Going to try pessary. Good. Okay. So let's talk about this for a moment. How painful is a dry mouth? You know, when you've got a dry mouth, it hurts. And what do? You sip on water. Dry bladder, dry urethra, dry vulva, dry vagina hurts. Anything you put on it, it's gonna burn. Anything. So what you have to understand about the estrogen is every time you give that skin estrogen, it immediately begins to plump up and produce mucus. It's like what happens when you put a raisin in a glass of water, it plumps up and absorbs water. Well, that's exactly what the cells do in the vagina and on the vulva. When you give that skin estrogen, they start to plump up, and most importantly, they start to produce mucus. You have to, and the burn, it will burn at first. If you're super dry, it's going to burn. But the burning goes away after about two. Every time you use it, the burning should get better and better and better. So the first time I used topical estrogen when I was 51 or 52, it burned for about 3 hours. But you see, I knew what it was. I expected that because my skin was very dry. The next time I used it, it burned for about an hour. The next time I used it again, it might have burned for 45 minutes. With 10 days, 2 weeks later, it burned for a minute and then it was over. You have to ride through the burn. The burn means your skin is very dry. The burn actually means you're doing exactly the right thing. So you got to give the estrogen a chance to work. If you don't, what's going to happen is you're going to get drier and drier and drier and drier, and then when you get really desperate and you want to try it again, it's going to burn twice as bad because you're twice as dry. And I've worked with some ladies who, by the time they're in their 80s, their little vulvas are like dry potato chips, and they're in agony. We don't want that to happen to you. The quality and health of your skin matters. Your skin is supposed to be moist. And the estrogen is the most natural thing you can do to trigger natural mucus. And they've watched it under an electron microscope. They watch what these cells do. It's very healing. But you gotta ride the burn. Don't be afraid of the burn the first week or two. Danielle said, I heard if you leave a yeast infection uncured, you can get sepsis. I've had mine for years. Danielle, what I would do with you, okay, Danielle, here's the deal. You got to understand that the symptoms you associate with a yeast infection, vulvar burning, vaginal burning, can also be caused by tight muscles. Vulvodynia is usually caused by tight muscles. I thought that I had a yeast infection when I was in high school. Oh my God. I can't tell you the number of times I used Monistat. I had no idea it related to the fact that I had broken my tailbone in junior high and had very tight muscles. So, what I would say is prove it. Let's prove it. Let's not guess. We need facts. You can ask for a vaginal swab with a next generation DNA urine test. And that test will tell us exactly what's in your vagina, good bacteria, bad bacteria, and most importantly, fungus. And if you have yeast, if you have candida proven by next gen, then you absolutely have candida. Um, but you just also have to understand that all of these symptoms that you would normally associate with a yeast infection can easily come from muscles. Easily. Um, Danielle said, "What is the bumpy ball inside the vagina that feels rough?" I don't know. I know exactly what you're talking about. I don't know the name of it. Loretta says, "Can you post the link to the compounding pharmacy you use in Arizona?" Sure. Yeah, it's womensinternational.com. The Women's International Pharmacy is a pharmacy that specializes in custom formulations, compounded formulations for patients who are very, very sensitive and who react to some of the bases that are used by mass market companies like Premarin. We don't recommend Premarin because I think if I remember correctly, uses alcohol as a preservative, and alcohol would burn skin. So Premarin is kind of notorious for causing a lot of extra burning. We do better with a compounded preservative-free estrogen cream. So getting to Dawn's question about the cystocele, you are not the only one. I've got another very good friend who just got diagnosed with a recurring cystocele, and doing a pessary is great. A pessary is basically comes in all sorts of different shapes and sizes, and you put it in your vagina, and it basically holds everything in place. And what you may not know is a lot of elite athletes, young elite athletes, compete with pessaries because their workouts were so aggressive, especially runners, that they have prolapses too. And so they compete with pessaries. So don't be afraid of a pessary. They're fascinating to try, lots of different shapes, lots of different sizes. There might be some trial and error to find one that actually feels good in your body that will hold things in place. But I would also want to know why he doesn't, we have to know the degree of the cystocele. If it's a very minor cystocele, then the pessary, good strategy. But if it's a progressing cystocele, then surgery might be the most important thing to do to stop that progression and just anchor things properly. When you have a prolapse like that, that means your muscles are very, very weak. Don says, I used to flare the week before and severely the day of ovulation. Afraid I'll have that pain from this. No period for over a year. Well, it's a valid concern, but you can't let anxiety stop you from correcting what is a fundamental problem. I have one patient that I worked with, and honestly, she was in her 90s the last time I talked to her. She may have passed because she moved from California back east. Um, they found her prolapse when she was in her early 70s. I'd known her for 20 years or longer. And she opted out of surgery when she was in her 70s. She just didn't want to do it. And what happened is it progressed massively. And by the time she was in her 80s, her bladder was hanging out of her vagina, and it's awful. Absolutely. And she so regretted not having that surgery because then she just got too old to have the surgery. And she ended up having a very large pessary that she couldn't clean. And so she had to go to the doctor every 6 weeks, and the doctor had to pull it out and clean. Oh, it's just so nasty. And she really regretted not being proactive. And I worked with her many, many, many times over the years. A midline cystocele. Let me look. My memory's good, but it's not that good. Well, they just say it's a regular prolapse when the supportive ligaments and muscles around your bladder and vaginal wall that hold up your bladder stretch or weaken. This allows your bladder to sag into your vagina. It's a type of pelvic organ prolapse. A treatment depends upon the severity of the cystocele. Let's go to Johns Hopkins and see what they say here. All right. Let's go through this. So what causes a cystocele? So, okay, hold on. Wait. So again, a cystostele is where the wall between the bladder and the vagina weakens. The bladder may drop or sag into the vagina. Grade 1 is mild. The bladder only drops a short way. Grade 2 is more severe. The bladder has sunk into the vagina far enough to reach the opening of the vagina. And grade 3, the most advanced, the bladder bulges out through the opening of the vagina. So what can cause a cystostele? Advancing age. Unfortunately, the loss of estrogen weakens muscles. Being overweight, childbirth, heavy lifting, straining during childbirth, straining while repeated straining during bowel movements. Please do not strain to have your bowel movements. Chronic coughing, previous pelvic surgery, or weak muscles around the vagina caused by the lack of estrogen after menopause. So, what are the symptoms? Feeling pelvic heaviness or fullness, bulge in the vagina that you can feel, aching or a feeling of pressure in the lower belly, lower back pain, frequent UTIs, urinary frequency, urine leakage, constipation, needing to push organs back up in the vagina to empty the bladder, pain during sex, problems putting tampons in, pelvic pressure that gets worse with standing, lifting, or coughing. So, how are they treated? Activity changes, avoiding certain activities such as heavy lifting or straining during bowel movements that could cause it to worsen. Kegel exercises, regular daily exercises of pelvic muscles to make them stronger. A pessary, which is a device placed in the vagina to hold the bladder in place. Surgery to move the bladder back into a more normal position. And hormone replacement therapy to strengthen the muscles around the vagina and the bladder. Okay, so using that estrogen, avoiding the straining, don't lift anything heavy, and giving the pessary a try. Perfectly reasonable. Hold on a second. Danielle said the last doc that diagnosed me said bacterial vaginosis and yeast, but left before I knew if it was cleared. Yeah. Well, a next generation DNA urine test will tell you exactly what's going on there. Marlia said, I got bladder leak pads called Honey Pot infused with lavender, mint, and aloe and was afraid to use them, but they make my vulva feel cool and soothing. Not sure if they are a bad choice, but I had a less irritation with Honey Pot than Poise. Plus, they also make them that are not infused. Interesting. Let's look at those. Okay, hold on. Honey Pot pads. And you guys, thank you, whoever that was who gave us some stars. If you find these, listen, if you find these meetings useful, please come on over to the website and sign up for our free newsletter or become a member so you can get our magazine, The IC Optimist. Or you can make a donation if you want, if you find it useful. I mean, listen, times are tough. We got bills to pay, and I have bills to pay myself. So we appreciate every donation and every membership so that we can keep the internet on, so I can pay for the hosting fees for our website, for all this sort of stuff, right? Okay, so honey pot pads isn't herbal infused pad. I have never heard of these. So what are they infused with? So they have organic cotton, regular pads with wings. I hate wings. Super pads with wings, overnight pads with wings, cotton cover everyday liners. Hmm. Let's 3.5 stars on their own website. Let's just look at their reviews here real quick. What are they saying on these reviews? Let's see if people are having skin irritation. So what's inside? Organic cotton, mint, lavender, and aloe. See full ingredients. Uh, aloe, rose, flower water, cordata oil, borneol, menthol, methyl lactate, corn mint oil, chlorine-free natural wood pulp. All right. So what are these reviews here? Okay, now hold on. I'm gonna go to the lowest ratings. Do not buy. Burns like crazy. Do not buy. Oh my God, whose idea was it to put essential oils in a dang pad? I showered, put this on, immediately had a burning sensation on my private parts like they were on fire. I assumed I didn't wash the soap off my private parts, so I ran the shower to wash them, put the pad back on, immediately figured out it was the pad. It was crazy how badly my private parts burn. I can guarantee you that's somebody with estrogen atrophy. That was Diana who posted that review 6 days ago, 7 days ago. Somebody said stings, stings. So, I mean, and yet, if we look at the good reviews, let's look at the good reviews. Let's go to the highest rated reviews. I've been wanting to try this brand. I have PCOS. My periods can be very painful. I absolutely love the herbal infusion in this product. The cooling effect has really helped me with my cramps. Um, People are using it on heavy period days. So just remember for that postmenopausal patient who's not having a period and whose skin is dry, I would probably not spend a lot of money on an infused pad and maybe do their non-infused pads because the organic cotton is the way to go. Organic cotton is awesome. They also have some anti-itch spray and anti-itch vulva cream with hydrocortisone and a soothing wash. Ooh, let's look at that. A soothing wash, a colloidal oatmeal wash for vulvas prone to itching. Now that's cool. Thehoneypot.co. That's kind of cool. All right. Thank you for that suggestion. Fascinating. Loretta says problems caused by rectocele. Rectoceles can cause problems too, honey. Danielle said, sometimes I have a hard time starting my stream. Other times it comes shooting right out in all directions. I think my pelvic floor could be failing for being too tight and too loose. If that's even possible, it's crazy because they never set me anywhere. Time to go have a proper pelvic floor assessment. Sue says, never hold your breath. Rhonda, hold that point here. Rhonda says, I'm doing a pessary presently. It's been a month. I've had around silicone one. Doctor said cube pessaries cause spotting and infection, and it's been okay. So Rhonda here on YouTube is getting great comfort from that pessary. Yay! Isn't it great that we can talk about this stuff? Isn't it great? Activate a stars party. Oh, look at I can activate a star. I have no idea what this is, Facebook. Bear with me. Let me see if I can. I don't know what a stars party is, but let's try activating it. It says I have 1 minute to do it, but I don't know how to do it. No, no. Oh, well, screw that idea. All right, hold on. Nancy says, on top of everything else, I have neuralgia, paresthesia, lower back pain, and front thigh numbing. I have low back pain, front thigh numbing, and a numb knee every now and then from my ruptured disc in my back. Danielle says, thank you for all you do. You got 500 stars altogether. Thank you, hon. Thank you very, very much. I really appreciate that. I really, I try hard with these meetings. I'm really trying to help. Let me look here. I see 100. I think only 100 got through, Danielle. I think your screen froze. I'm not seeing any other messages showing any other stars. A star is a way somebody can donate on Facebook. Each star, I think, is equivalent to like a penny, or it might be a tenth of a penny, something like that. I'm not sure on that. I'm not sure. Don, let's see. Thank you, Sandra. Sandy sent 50 stars. Danielle says you're a star. Gay said I use pre-leaf to take the acid out of food. Excellent. Carolyn says I'm going to stop drinking my well water. Is Deer Park okay? Carolyn, just get your well water tested. Don't stop drinking it. Get it tested. Call your county health department, water department. Ask if they'll come out and test it. Sue says, my husband thinks it's great that we can talk about this stuff. We're listening while having dinner and he's making funny faces. Oh, I love it. Okay, Sue, I'm going to talk to your husband for a moment. So a lot of women ask, now, I mean, this is, listen, you got a gem of a husband. So this isn't to him specifically, but I want you to look at his face for me, okay? Because there are some men out there who don't believe that the bladder can hurt so bad. I know because I've talked with them and they call me, I mean, or their wives will put them on the phone with me. So what I say to them is, okay, imagine that you're walking down the street and a complete stranger walks by and grabs you by the balls and squeezes as hard as they can. Now imagine they don't let go for a year. That's what IC feels like. Hopefully he didn't just faint, but that's how I describe it to men who are being aggressive. And that's true. It's very, very true. Paula, thank you so much for the 100 stars. Danielle, thank you for the 200 stars. So what does he think of that? Sue says, I only drink Ice Mountain spring water. I can smell the bleach in our tap water. Danielle said 500 stars of $5 plus tax. Okay. That's why I always encourage people to come on over to the IC Network and buy something. Like our book, IC 101. Oh, also too, I just found out that the next generation DNA urine testing, which was $199, the price was increased just a little tiny bit. And our website, Bladder Health, which talks about that, I will be updating this week with all sorts of new information on next generation DNA urine testing, because this is the future, absolutely the future of urine testing. And so you can expect some links from me on that in the coming week, because it's just super, super, super important. For those of you who really think you have infection, let's not guess, let's prove it. Because the biggest barrier we have is that, the bladder only knows one language: frequency, urgency, pressure, pain. A bullet wound feels like an infection. A stab wound feels like infection. Cancer feels like infection. Everything feels like infection, because the only way that the bladder can tell you that there's a problem is with those symptoms of frequency, urgency, pressure, pain. And the same is true with vulvodynia. The only way that the vulva can tell you that there's a problem is with the symptoms you associate with the yeast infection, even though it might not be a yeast infection. It might be ischemia from tight pelvic floor muscle. And so for those patients who are just like, and God, who was that? Oh, I got to tell you, I've been working with a patient who, it's been very, very interesting. And I want to do a shout out right now to the Reddit IC group. I think the Reddit IC group, it's very, very good. I mean, listen, my group, I think is really, really good. But people don't use websites anymore so much. People go right to social networking, and there's too many social networking for me to do it everywhere. Plus, I have other things I want to do now. And I was hanging out in the Reddit IC group last week, and I got to tell you, that group leader is really good. She understands issues. She's addressing things really correctly, and heads and tails above a lot of the groups that you would find here on Facebook. Um, anyway, there was somebody who it's kind of a whole long story, but let me just say that um, this one patient was absolutely convinced that they had a bladder infection, even though every culture was negative. And the patient is like, but this is a bladder symptom. This is a bladder symptom. It has to be my bladder wall. And it's like, honey, you had a hydrodistension with cystoscopy. Your bladder's fine. Or no. He'd had a cystoscopy. Your bladder looks good. All of your urine testing is negative. All of it. Multiple rounds of urine testing. Every single one of them negative. Has a pelvic floor assessment. Pelvic floor assessment finds very tight muscles. But this patient was just like, but it's my bladder, it's my bladder, it's my bladder. And I'm like, it's not, it's not, it's not. And they were an academic, right? They weren't medical academic, but very, very smart, extremely smart. So I had to brace it in academic terms. And it's like, we have to follow the data. So data point number one is your urine tests were completely negative. They found nothing. Data point number two is you had a cystoscopy, not perfectly healthy bladder. Data point number three, your pelvic floor muscles extremely tight. So we're talking is like, and I'm like, can you remember any trauma? No trauma. I remember everything. I'm like, well, your muscles are tight. That's not normal. No, nothing happened. It has to be my bladder. I'm like, follow the data. And then, and they're just really anxious, just consumed with anxiety, just spinning, bladder, 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 bladder. And I had to reach out and stop them and say, no, wait a second, stop. Now, if you think you have, oh, and they had a next gen DNA test, which like 2 years ago found something, but it was treated, right? Okay. So it often one of my jobs is to kind of stop you from spinning and stress and anxiety and go, okay, slow down, deep breath. We have to follow what we know. It's like solving the mystery of your pelvic pain. What are the suspects? Bladder wall, healthy. UTI, gone. There's no UTI. Pelvic floor, very tight. Are there any other symptoms? And at one point in time, this patient pointed, I think, to another symptom, and I went, got lower back pain? That's really important. And anyway, the point that I'm trying to make here is that you deserve more than a guess. You need facts. And so what I ended up saying to this patient, all right, okay, if you still think you have an infection, order another next gen test. If you're that, and I was very honest. I said, listen, I didn't believe when I was diagnosed with IC. I thought I was dying of cancer. True story. My first year with IC was agony. I couldn't drive without crying and screaming every time I hit a speed bump. I was convinced I was dying of cancer. And when they told me it was IC, I just flat out said, I don't believe you. And I said, open me up. I want exploratory surgery. I believe you've missed something. I think I'm dying. September 1993. My doctor did it. He's like, really? And I'm like, oh, hell yeah. Absolutely. And I woke up in the recovery room with the doctor saying, Joe, we found nothing. You're not dying of cancer. You have IC. Now, this was 30 years ago. Now, the way we would answer that is, Jill, we looked at your bladder, perfectly healthy. Obviously, this is your muscles and your nerves, you know? Fascinating. Absolutely fascinating. So just don't be invested in one specific theory. We got to check stuff out, lots of stuff out. All right. Sue says he's still standing. He's been with me for 40 years. Oh, I'm so happy for you, Sue. See, you got good things going on. I wish I had a man like that. Danielle says, when we connect on the phone, I'd like to order with you if that's okay. Sure, not a problem. And you're going to go talk to your birthday boy. All right. Angie said the smell of bleach gives me an instant headache. It never used to be this bad. Yeah. Danielle says I wouldn't be alive if I hadn't found you. Oh, I wanted to be opened up too. Okay, Danielle, we're going to talk it through. I'm going to try to help you. Okay. We're going to come up with some new questions. Part of my job is to educate, inform, and then give you a new list of questions, kick you in the butt, and get you back to your doctor to ask a completely different set of questions. All right. Wig Realtor says, where do you get the drops? Are you talking about these drops, the super lysine? I got them at like a Whole Foods. You probably get there by Quantum Health. You could probably get them on Amazon. Megan says, it took me quite a while to understand how muscles and nerves can create that level of pain. I know, right? I think about, I mean, like, there's a part of me that's just so, I'm so relieved to know what caused all of this for me. And I'm so relieved to know it was never my fault. I didn't do anything wrong. But I spent decades in pain because it started in seventh grade. But I just had frequency urgency in seventh, eighth, and ninth grade. But then in high school, it was the severe vulvar pain. And then in my 20s, it was severe bowel pain. And then it was migraines. And then it was this. And then it was that. And then my bladder started screaming when I was 32. And when you're that patient and you're stuck in this chaos of pain, it's so confusing because it's like, wait, do I really have all these different diseases? And the answer is no. Now we know the connection between all these painful conditions, and that's this injured nerve. Central sensitization means that we have an injured central nervous system. How does that nervous system get injured? Physical trauma. For 80%, there's a physical injury, like falling and breaking your tailbone. You'd be amazed at the number of patients who have fallen downstairs or have had tailbone injuries. I mean, every week I talk to new patients who have fallen downstairs as kids or have suffered injuries as kids. It's the root cause. And then for the other 20% of it's often a history of abuse or bullying. And the blessing here is that there's no shame, that there's no blame, there's no mental illness other than depression and anxiety from struggling for so long. And that's not insubstantial, that's rough. But we also know therapeutically now how to treat this correctly. And that is to calm the central nervous system. And when we calm the nerves, the pain level drops. If you are anxious and in pain, your brain is going to intensify that pain because your brain thinks your life is at stake. We have to prove to your brain that your life is not at stake and we can calm everything down. We want to get the brain out of fight or flight and get it back into normal, healthy, non anxious muscle tone. So, 14 days of pain will put the brain into a constant state of fight or flight. 20 days of bullying will do that. And so, by this is why it's just so incredibly important that we calm everything down. We got to calm tight muscles down. We got to calm tight nerves down. We got to calm an irritated bladder water down. It's about bringing the volume down. And with that central nervous system, the way we do that is with some really simple, basic mind body techniques. And again, I'm willing to talk about anything. I will tell you that, um, listen, I had terrible anxiety disorder in my 20s. Terrible. And of course, that's a sign of central sensitization. And then I took a class in my mid 30s, completely changed my life, gave me skills, haven't had a panic attack since I took the class. I know now how to handle part of that. But with COVID and the freaking fires, listen, I struggle with anxiety again a little bit, not like it was, but I catch myself having negative. I was walking when I was walking this morning. A guy was going past me, and I had a negative thought that maybe he would attack me. Classic catastrophizing thought. And I had to deliberately stop myself and go, "You're perfectly safe. There are tons of people here. There's no reason to be anxious right now." That's why I like Joel Osteen. I love Joel Osteen because he's so good about getting you to remember that we have to address that anxiety promptly so that it doesn't interfere with the things we want to do with our life. Like get out of the house and walk. Sue says, it's just so hard, Jill, to explain it to other people, especially when you have so many overlapping conditions. That's exactly how this terrible doctor got away with what he did. He took advantage of patients that didn't have the right diagnosis. And this was as late as 2021 when subtypes were already a thing. Yep. So, one of the techniques, so I have a really good section on the IC Network website with mind body medicine. And one of the techniques that you can do to calm your nervous system is really kind of silly, but it actually really works. You buzz your lips. If you go, you have to make the sound. So that's what I'm on this remote trail, right? But there are lots of people around. And this guy walks by and he's gone. And I'm like, stop it. I'm sick of it. Deep breath. And then it's like I decided that I needed to buzz my lips for a couple of minutes. So I walked doing that. You can also use tapping. The tapping EMDR technique's the tapping technique is very good. And then the eye movement technique's also very good at calming the nervous system down. Marlia says, when I used a new Estriol, a compounded cream, I felt puffy. I hate that feeling, but I'll deal with it because it is doing its job. But I also feel a bit itchy, like yeast itchy, but never the cotton cheese discharge, just the pubic bone area. Could I use hydrocortisone cream for that itchiness? Or not a good idea? Or use yeast cream like a clotrimazole? Not sure why the itchy is after CS triol. I'm 73. I'm a 73-year-old crinkle crotch. Gotta laugh or we cry. You got it, girl. The problem with hydrocortisone is it thins skin. On the other hand, if you have something called lichen sclerosis, which is very, very inflamed nerves in the skin, clotrimazole, which is a very strong steroid, is what they want you to do. So I think it's very important that you go to your gynecologist and have them look at your skin. Skin from lichen sclerosis turns white, and it's very, very tender to touch, extreme inflammation. I know this because my mom had this. When I took her to the gynecologist and I would be looking at her. Yeah, see that, see that, see that. I was that involved with my mother's care. You know, is what it is. So we want somebody to look at your skin and make so you know what we're dealing with here. Um, I would be very interesting to try lidocaine cream if that soothed the nerves and turned it off. That would be good information for your doctor to know. And also dryness. Are we dealing with super, super dryness? And with something as simple as V Magic, an over-the-counter cream, an over-the-counter jelly, would this protect that skin enough to make it go away? I will tell you too, Marlia, that sometimes when I walk, I get little tiny pinpricks. And that tells me that my muscles are getting tight and I've got to do my muscle work. Megan has to leave. Thank you so much. You're very welcome, Megan. Have a great week. We're about done. We're very close to being done. Sue, what estradiol cream would make a person puffy? I don't know. It's just really their individual tolerances. So, all right, guys. Well, listen, we've been on for 3 hours and 20 minutes. I think I have to learn my lesson from 2 weeks ago when I did this for 6 hours and I strained my voice. So let's do this. I think I'm going to call it right now. And there's something I really kind of want to do. Here, hold on. Let me look at something real quick. Hold on. Okay, no, I've got till 5:30. Yeah. Okay. Okay, so that gives me 90 minutes. So I can do another 45 minutes. So why don't we do this? Does anybody want to go into Zoom? If you want to go into Zoom, I can set up a Zoom for anybody, but it'll have to be just kind of on point. And you can ask your questions yourself privately. If not, we'll go ahead and call it, and I will see you again next week. All right, no takers for Zoom. All right, listen, you guys, here's your homework. I want you to laugh. You need laughter in your life. I want you to watch funny things, watch funny videos, go to YouTube, watch funny shows. The more you laugh, the more you produce natural painkillers. Stay off of things that upset you. Do things that bring you comfort and bring you joy. Okay? All right, Donna, I'll talk to you later, honey. Big hugs. Big giant hugs. All right, everybody, I'll see you later. I'm actually going to go buy a couple of pumpkins for my front doorstep. Okay, I'll see you later.